be working under a microscope, also on the zpad, and we'll review 5 interrupted sutures. I'll go over the simple interrupted, okay? Because if you don't master the simple interrupted, you're missing out on 90% of all types of suturing. Then we'll go over horizontal horizontal suture, 2 types, the visible one and the non-visible, the hidden one, and I'll explain what's the difference between the two. Then we'll practice the X-suture, both the visible and hidden, and then I'll teach you a cool suture called the Laurel suture, the modified Laurel suture, where you can basically avoid engaging the area that is close to the incision line. A lot of the patients have, when we do surgeries, sometimes the tissue is inflamed, the gingiva is friable. And we are live. Hey everybody, Ziv Simon here. I'm the creator of Surgical Master, and I'm here with Dr. Rashad Riman, my co-founder, my partner and friend. We are inside a live recording of what we call now the Master Your Suture. This is going to be a segment in Suture Academy. We already have hundreds of dentists inside Suture Academy. It's one of our blockbuster courses, and we are constantly upping the game. We want to create the best suturing training ever created, and for that we took a studio. I'm right now in the studio. You see these guys working on all sorts of technical things that I don't know a whole lot about. But what I know is that they're giving us an amazing result because what we want to do is capture suturing technique in the most simple way, the most concise way and clear. So you can see exactly the needle entry and exit points. You can see the hand movement. You can see how I utilize the instruments. You can see all the knot mechanics and everything that you need to know for suturing. Why? Because suturing is extremely crucial for success. So there's no good surgery without good suturing. So you can be an amazing surgeon. You can have, the hands of gold, perform your procedure, no problem. But if you mess up the suturing, you're gonna mess up the whole surgery. And we call suturing, it's our secret sauce for your surgical success. Now it's slow motion and super high definition. So it's extremely important. So I wanted to show you a little bit in this studio. We are giving you the behind-the-scene view of what's happening in a recording of one of our courses. You may have attended some of them before. Basically, we have this studio here. It started off as a blank slate, a clean slate, pure white, and we dressed it up as an education center for suturing. We've been filming this now for a couple of days from different angles. So every suture is repeated again and again and again. I'm performing all of them. In the next segment, I'm going to be mentoring Rashad on suturing. And we are capturing it from different angles, buccal, lingual, occlusal. We have special lenses called the probe where you can see the needle going in, and it is going to be the size of a sword on your screen. It's that up close. Why are we doing this? Because we know that suturing is critical to your success, and we want you to be successful. Like we had this year, we've been closed. We had all sorts of financial challenges. Our patients are not coming as easily, and we want to start 2021 strong. We don't want to be just slowing down even more. We want to start really strong when it comes to the practice of surgery. We're going to be doing a lot of extractions, a lot of bone grafts, a lot of implants. Patients are still breaking teeth. So dentistry did not die from this pandemic. Patients are breaking their teeth. They're having all sorts of dental, periodontal, endodontic problems that keep us busy. And we want you to be prepared. Part of it is being able to suture. So our main suturing teaching tool is called the zpad. That's the back, that's the front. So what is zpad for the ones of you that have never seen it before? The zpad is basically our proprietary suturing pad that has all the different scenarios in the mouth for surgery. So you'll see basically almost like a glimpse in time where the flap is open and you learn how to close it up. Extraction socket, incision lines, full arch closure. All the important suturing exercises are going to be demonstrated on the zpad. And again, like I said, we're going to capture it from different angles, in slow motion, in high definition, in extreme close-up, so you can finally understand. It's not just another YouTube video or an instructor suturing a banana or an apple or a pig's skin. This is the real thing. So we want you to be able to suture and understand. Then we'll start basically with the foundation today. We'll talk about the instrument and the instrument design. This is my personal caster that I use in my practice. It allows me to use finger movement and not wrist movement. Okay, so kind of the wrist twist is dead. If you already attended Suture Academy, we used to talk about the wrist twist. It's mostly the finger twist. And believe it or not, it doesn't have to do with the surgeon's talent. It has to do with the instrument design. If it's a bit rough, you'll be able to do it. There are not too many tools that are needed for suturing, only 3. Obviously a needle holder, we recommend a Castro Viejo, cotton pliers, and scissors. That's all. I'm going to go over that. Then tomorrow we have a special guest. His name is Dr. Jason Champagne. He's a plastic surgeon in Beverly Hills, actually in my building. He stitched me up real good. I forgot which side. There's no scar left. And we are premiering our new zpad. The new zpad is called zpad Survival. So what do you see in Survival? You see different face parts. Okay, you see a nose, you see a cheek and an eye and an ear. And what's very pertinent for us dentists, you see the lip and you see these different types of lacerations and injuries. This zpad was made by our artists working for us for many years, who made the original zpad. We call it now zpad Classic. And we now would like to give you another option to practice suturing. This is also going to be for medical professionals, medical students as well, or people that are interested in being survivalists or going hunting. If there are all sorts of injuries, they'll be able to suture them. So we're branching into that. And there's nobody better to teach how to suture facial lacerations than a plastic surgeon, especially a Beverly Hills plastic surgeon that has all the microsurgery techniques and very picky patients. So we'll have Jason Champagne tomorrow here. You'll see it in the broadcast. He's going to teach us how to correct those facial lacerations with suturing. And I'm excited about it because I always wanted to know how to suture a lip in the right way. By the way, this zpad is made based on my face. Not that I'm in love with my face at all, but we thought it would be fun to take an impression of my face, cut it up, mess it up, injure it, and then lay it out on the zpad so we can have fun. So if you want to suture me, you'll be able to do it, okay? So that's, these are the two zpads. The one in making is our zpen hand, which we'll also introduce to you, which will be more hand injuries. And even if you're a dentist, it's a lot of fun to suture that. So let me show you a little bit what's happening in this studio. Right now, this whole segment here of the studio was changed for the filming of the next part. The next part is called suturing mentorship. Okay, so I'm going to be mentoring Dr. Rashad Riman. He's going to be sitting right in here. Okay, so he has his own seat. He actually has his own microscope. Okay, I'll be sitting on this desk right in here, and I have my own surgical loops times 3. He's going to be doing it times 20. We have an overhead camera. Same Rashad will have all the footage captured. And I'll be reviewing 5 different types of suturing. Why 5 and what type of sutures? We're going to go over only interrupted sutures. The majority of all surgeries require simple interrupted. Believe it or not, 90% of all surgeries, the main suture we're going to be utilizing is a simple interrupted suture. So why is it so complicated? Well, it's not so much the suture, it's more where you place it. What's the sequence of suturing? What's the strategy of suturing that is important? And second, if you think that you know is simple interrupted sutures, that's great, but a lot of dentists are having issues with flaps opening up, sutures that are not stable, sutures that poke the patient. So that's why we're doing it. And I'm sitting here next to my partner. Hey, Rashad.
Hi, Ziv. So we had some technical difficulties. If you're watching us right now, we just sent an email with the YouTube link to watch this broadcast. And you know what? We're going to move on, just like with anything in life. We have difficulties, we push through it, and we move on. We really believe in what we're doing for you here. And it's really a treat to see behind the scenes. So we're going to talk about a surgery I did, a free gingival graft surgery. Michael, if you can play the trailer for that surgery, that would be great. The first part of the pre-gingival graft surgery is the preparation of the recipient site. You go along the mucogingival junction, you angle your blade at a 90-degree angle, you pull down on the lip, and then you start making incisions, and then the mucogingival, the mucosa just pulls down.
You were on top of it, so I was very numb all over. So really pain-wise, there wasn't like any pain, honestly. You know, you can feel pressure sometimes, but you're not feeling pain.
The next part is the harvest. So first we prepare the recipient site, then we harvest the tissue from the palate, and after that we suture the harvested tissue to the recipient site that we prepared.
But I wouldn't be scared of this, as far as like you did a great job of making sure you had pain meds where it was needed.
We just finished harvesting the attached gingival from the palate. Now we're going to take the piece of tissue we harvested and suture it to the bottom. You win as a doctor by adding value, increasing your bottom line. Your office wins because you are offering patients things that they need.
And then obviously came to you and you said, you know, this is what this is, and you can prevent it right now versus, you know, what's the long term? Like you said, if I might lose my tooth, it might spread to other parts of my gum line. one surgery versus possible 2, 3.
Excellent, excellent. So this is a surgery that you did in your office, a
Yes.
free gingival graft.
Free gingival graft. And you know, you coached me on that surgery, Ziv, and suturing is a key element to having success in a free gingival graft surgery. So it's interesting. I got the surgery down based on how you teach it, the recipient site preparation, harvesting, and then the suturing of the graft to the site. So Michael, why don't we show the first part of that surgery, the first video?
And in this video, I'm going to break down step 1 of the free gingival graft surgery, preparing the recipient site. The technique you see here follows the same system that Dr. Ziv Simon uses to do his surgeries.
Step 1, and that's very important. You gotta numb up both sides, left and right. I'd rather the patient feeling a little more numb than feeling pain during the surgery. To do that, you can use lidocaine, 2 carpules for each side. Step 2, and that's very important. You want to minimize the amount of things you need to do once you have an open wound. So, before you put a blade to the tissue, prepare all you can. Simply use the carton that comes along with your suture, use a scissor, and cut it up to the size and shape that matches the defect that you are fixing. Step 1 of the free gingival graft is to prepare the recipient site. And we have here a frenum pull right there. And we have recession and an issue here. So we gotta go along the mucogingival junction, which starts when you move it like that. You can see where the tissue, loose tissue is versus the attached tissue right here. This is attached tissue, this is movable tissue. So we go across the mucogingival junction. We use our thumb to pull down the lip like that. And then we just make an incision along the mucogingival junction. And then we just let it, while we pull on it, reflects. As soon as you put a blade to the tissue, you start the countdown timer to the point to where the patient's numbing is gonna wear off. We have a little bleeder here, so what we're gonna do is we're gonna take anesthetic. And then we're just gonna control the bleeding by pumping some. Again, we go back, section. Now, you are racing against the clock to make sure that you go in, repair what you need to repair, close it up, stabilize it, stop the bleeding before the patient's numbing wears off. A lot of times what happens when you give patients many carpules for extended periods of time, the numbing stops working. The word on the street is there's a lot of pain involved with this surgery. So now I implemented on Reed the same system of pain control that we teach in the Masters of Soft Tissue program inside of Surgical Master. So, and that system is designed in a way to minimize the chance of having the patient experience a lot of pain.
As far as like, you did a great job of making sure you had pain meds where it was needed. Even if it was unnecessary, maybe in some part, you were on top of it. So I was very numb all over. So really pain-wise, there wasn't like any pain, honestly. You know, you can feel pressure sometimes, but you're not feeling pain. And again, like you said, we had a kind of communication of like, if you feel anything, you know, raise your hand, you know, so then you're on top of it.
Maintaining good visibility is important for you to execute the procedure properly. So, one way that we control bleeding in the surgical site is by injecting 1 to 50,000 epinephrine or 1 to 100,000 epinephrine lidocaine, as I'm doing in this case. In this case, I used 1 to 100,000 epinephrine lidocaine. The blood was still coming through though, so 1 to 50,000 epinephrine lidocaine would have been a better choice to have more controlled bleeding.
So that's the initial incision for the recipient site. See here how it's a smiley face. Now what we need to do is we need to grab this and suture it apically. Here. So initially the tissue was here, then we reflect it here. It was initially, give me a tissue forceps. So initially the tissue was here, it was attached high. We reflect it, so now we can attach it lower and create space for the graft.
No pain though?
No.
Good.
You know, so that communication, like I never felt uncomfortable. I always felt like I was in touch with you. If I needed you, I could raise my hand, say, okay, that hurts, but nothing really did because you were so in front of it. And then when you had the headphones for me to put something on to listen to, and also you had some essential oils as well, you know, pumping through. So, I mean, I think if you set it up for the patient and you're feeling super confident, your bedside or table side manner is so just calm and relaxed, like I got this, like confidence just exudes into the patient. For me, it's like, well, it's Rashad. You know, I'm just gonna sit back and let's keep, listening to my stuff, and it's gonna be great.
I felt confident because I have clarity on the exact step-by-step for this procedure. I follow exactly the same system that Dr. Ziv Simon uses to do his free gingival graft surgeries. Now, as far as making sure that the patient is always feeling comfortable, I do several things. First, I make sure that the patient has glasses on. I also make sure that the patient has noise-canceling headphones on. Bose is a great brand that makes really nice noise-canceling headphones. I also introduce essential oils. Yes, I love essential oils, and they have a very relaxing effect on the patient. And all in all, I'm creating an experience. Yes, it's a surgery, but it doesn't have to smell like a surgery. It doesn't have to feel like a surgery. It can feel borderline spa-ish. And when you do that, you're gonna be in a position where your patients are saying great things about you and your practice. You're building your practice. And you know what? It feels really good to treat people well, get well compensated for it, and then have your reputation speak for itself in your community.
So that's like this, and so that's the top part of the T, and that's the T here.
Now what I'm doing is I'm suturing the reflected tissue to the underlying bed of connective tissue. The goal here is to stabilize the reflected tissue. That way I create enough space to place my graft later on. My first suture is right in the middle, and then I start splitting the difference.
I'm gonna do another T. I'm gonna call this a reverse T.
Yeah, so I, gradually saw the recession of my gum line, and it just didn't look right. Started to see more bone, and it just didn't seem right. And I'm like, okay, this doesn't look right. And then obviously came to you, and you said, this is what this is, and you can prevent it right now. And if it goes, and also my other dentist that I go to sometimes said the same thing, like, this is preventable right now. If it goes 2 more millimeters further, then you're looking at a lot more of a more intense surgery and possibly other things happening, the bacteria going elsewhere. So for me, I'm like, okay, I'd rather prevent something before it gets too bad.
The suture of choice for holding the tissue down is called the T-suture. Check out how I execute the T-suture in here.
Difference. So 1, 2, 3. I want to put one here. Maybe another one here. Okay.
And voila, all that tissue is tucked down to the connective tissue underneath. And it's stable. There is one key thing that you must do at this point to better prepare the soft tissue bed to receive the graft. You see, the more connective tissue that's exposed, that's bleeding, the more pipelines of blood you're gonna give to your graft, thereby maximizing the chances of its success. You gotta think of the graft as a carpet, and underneath that carpet, you gotta extend to it bloodlines, pipelines of blood that are gonna give it life in the weeks to come. The more pipelines of blood you have, the higher the chances of that tissue succeeding and the graft succeeding and you solving the patient's issue of poor quality tissue and recession in the area. So what you do, you take a number 15 blade and you envision the area where you're gonna lay your graft, and you simply angle the blade carefully in a way where you scrape off the top layer of gum tissue, exposing tissue underneath that is bleeding, where your graft is gonna extend its lifeline. Take special precautions and be especially careful when you're scraping off the tissue that is frail or thin or where there is a lot of mucosa, because the last thing you want to do is create an accidental tear in the tissue. Now, it's fixable, but it's better to be prevented. Enjoy and learn more about the Masters of Soft Tissue program. Click the link below.
Great. Welcome back. Nice work by Dr. Rashad Riman. Can you believe that only 3-4 years ago, he was not even close to doing soft tissue grafting and procedures like that? And the key, by the way, the key for success in a soft tissue graft is really not the harvest. It's not even the tissue manipulation, it's the suturing. Because for a graft, you need to have stability, you need to have great blood supply, and you need to have, let's say you're doing root coverage, you need to have the tissue sutured coronally and stabilized. So if you do a great surgery, but you mess up the suturing, it's not gonna work.
Yeah. Well, I never thought I would be able to do that as a general dentist, to really do soft tissue engineering and manipulate soft tissue like I'm doing now. And it's really thanks to you, because you break it down step by step. And what you just saw right now in that video is the first step, which is the recipient site preparation. And Ziv teaches it in an extremely awesome way. Those of you in Masters of Soft Tissue understand how Ziv teaches that and understand better of how to do that surgery. It's very doable. If you're a GP, you enjoy surgery, that's something that you can totally do. It helps with two things: anterior recession cases, which we all see that in our practices, and building attached gingiva around your implant cases. It's both. It ups your quality of what you deliver, plus it's an additional source of income that you can add to your practice, because you are doing a surgery that is adding value. So we'll play the second part of the surgery in a bit, but first let's take them on a tour of what's happening here, because the idea of this broadcast is to show you behind the scenes of how we're filming the Master Your Suture broadcast, which is an addition to Suture Academy. And in a nutshell, Suture Academy is a way for dentists to really nail down suturing, because we graduate from dental school, not much time is spent on it. It's kind of like rushed, and we get into our practices and we sometimes get tired by the end of the surgery. We rush the suturing, we don't suture properly. It leads to our bone grafts failing. It leads to delayed healing. It leads to frustration. Mastering suturing will help you master your surgeries better. So, Michael, if we can cut to the other camera so we can give them a tour of, let's start out from the outside. So we're in this beautiful space here, and it's a very large space. See if you can, so this is where we got the lights set up. And we're gonna be filming right there. We've got the, audio, proper audio. We've got some microscope footage. It's gonna be very beautiful and clean. Tom, can you tell us a little bit about this setup that you have over here?
So you have two.
So let's make sure we get your audio. Can you come on next to Z? Yeah.
Make sure you look at him and I'll capture.
Yeah.
So we basically have a kind of an interview set up here. We're gonna do a wide shot. We've got a wide camera here. We've got two profile shots, a nice medium shot on both Ziv and Rashad. And,
what's these big things for over here?
So these grids help diffuse the light and help flatten the very beautiful soft skin tones. So back here we have the 300D Mark III on some aperture domes. So this helps also to give very soft light.
Cool. So we got two of these screens, one here and one here.
Yes, we want to evenly lit light. So we have a soft box on this side, two on this side. Going to give, it's a very soft looking image for the viewers.
Excellent. And how are we capturing audio? We're capturing audio in two ways, right?
Yes, we've got basically we have labs and we might have each one on Rashad and one on Dr. Simon. We've also got this microphone here, This is going to help pick up some ambient sounds and so on.
Good. So, when would you think you're ready for us to sit down and start doing the testing for them?
I think we're almost set. We're just tweaking some audio settings. So give us about 5 minutes and we should be ready to go.
Cool. So, Michael, in the meantime, can you, Ziv, what do you think? Let's play video number 2.
Harvesting a free gingival graft, and then we'll see at the end, we'll see the suturing, so it's going to tie really nicely into the training, because you're suturing with simple interrupted.
Yes. Okay, Michael, can we go to the video number, the second part of the surgery?
And in this video, I'm going to break down step 2 of the free gingival graft surgery, harvesting the attached gingival graft from the palate. The technique you see here follows the same system that Dr. Ziv Simon uses to do his surgeries. We're done with the first part, the recipient site preparation. The next part is the harvest. So first we prepare the recipient site, then we harvest the tissue from the palate, and after that we suture the harvested tissue to the recipient site that we prepared. Step 2, harvest of the graft from the palate. The first thing you must do is make sure that your palate is profoundly numb. Yes, you want to make sure the palate is blanched. You can use lidocaine, septicaine. So make sure it's numb, then proceed to placing the template anterior to the first molar. You got to stay safe. Stay away from the GPA. So that's our template we're gonna follow. We're gonna dig it in the depth of the, you notice the blade has a part that's shiny and a part that is matte. We're gonna dip in to the part that is matte. Let me show you here. Part that's shiny. So this is the part that we're gonna go deep to this, just past this. All right. Be 2 millimeters at least from the free gingival margin on the lingual side of the teeth. Place your template, stay away from the rugae, and cut around the entire template. Start teasing the corners first. First, create the entire outline. After you have the entire outline created with the blade, make sure that your square is completely severed on all 4 corners. Proceed by using the blade in a sweeping motion to go to the corners and pick up those corners with the blade. There's a little bit of artistry involved in here. So we start to fillet it. We fillet it. You lift up those corners, then you grab the tissue forceps. You use the tissue forceps to fillet the entire graft. The key, the better your initial incisions, the more uniformly deep they are, the more past the corners that they are, the easier time you're gonna have with filleting the right amount of tissue. Now it's a challenge. Sometimes you fillet too much tissue, and sometimes you can fillet too little tissue if you don't make the cuts 1.5 millimeters deep. And there you go. You tease the fillet of the graft all the way down, and voila, you have yourself a free gingival graft. Enjoy and learn more about the Masters of Soft Tissue program. Click the link below.
Excellent. And we're back here. I think, Ziv, this is a good place here where we can pick up the training. What's this thing hanging here? Okay. Perfect. So Ziv, what do you think of this? So this was the second part, the harvest. I had some difficulty there with the angulation of the blade to be able to angle it to get that piece of tissue out. Any tips that you can give on when you go to harvest? It's the palate, there's the teeth in the way, it's just awkward.
Yeah. First, to have a shape of palate that is not easy to harvest. So the deeper the vault is, the deeper the palate is, the easier it is, because the area you're harvesting from is almost parallel to the teeth. But the more flat the palate is, as you harvest, you're going to be bumping against teeth. So that's just one thing. The other thing is your patient had Rugen that was pretty far back. So you were a little bit limited in where you can harvest. So the most important tip that I give dentists when they start harvesting free gingival grafts, or grafts in general from the palate, is lean the patient back as far as possible. If you're harvesting from the right, assuming you're right-handed, have them tilt all the way to the right and chin up.
Okay.
Don't tell them head up, tell them chin up, tilt all the way to the right.
As an exercise, we can show, this is where you can, right there, so the zpad has an exercise where it teaches you how to close, this is for a connective tissue graft, right?
This is for a connective tissue graft. So basically what we're teaching inside Suture Academy is once you harvested your connective tissue graft, what do? How do you close up this incision outline? There are actually more than a couple ways to do it. Today we filmed the continuous interlocking. You can also close it with multiple X-sutures. There's sling sutures, you can sling around the teeth. There are a couple of options, but again, it's not so much about the technique, it's about understanding what are you trying to do. You're trying to approximate the wound. You're trying to put palatal pressure. And if you know how to execute the suture, you're going to get hemostasis.
Awesome. So,
that's what you want.
So Michael, let's go to the last video where I suture. Time, guys and ladies, we'll come back to the studio and we're actually going to start one of the segments for filming the Suture Academy, the Master Your Suture. So Michael, why don't you take it and play the third video? We just finished harvesting the attached gingival from the palate. We got to control bleeding, stop the bleeding on the top. Now we're going to take the piece of tissue we harvested and suture it to the bottom.
It's important to control bleeding after you have harvested the graft. One way of doing that is by applying Hemodent or a similar astringent solution. Another way you can use is an electrosurge. In this case, bleeding posed a challenge. The patient was bleeding profusely and I had to use several techniques until I finally got it under control. I proceeded to placing periacryl to cover the entire wound and then covering it with resin. Yes, flowable resin, which I tacked on top of the wound with periacryl. And that's how I created the palatal seal in this case. I then trimmed the graft at the edges to a 45-degree angle. The reason I do that is because I want the graft to adapt well to the recipient site. If it's too thick, it's going to be like a thick carpet and there's going to be a step between the ground and the carpet. However, when you trim it on the edges where the carpet meets the ground, it can be more flush. So I take it, I angle the number 15 blade at a 45-degree angle, and I slice all the way through. One tip here, make sure your blade is very sharp. It'll make your life a lot easier here. As you can tell, this blade needed to be changed. So have multiple blades out and have your assistant constantly replenishing them. Use a fresh blade for this process. And keep your graft in saline, or if you do PRF, you can keep it in the PRF solution. So we're gonna now put the graft on the recipient side. See here, it's a little bulky from the top, and even the side here. I'm gonna trim that. Yes, let's open the blade. That's better. You can see here better adaptation. Cool. Now let's start suturing. The key when you're suturing the graft to the recipient bed is to make sure that the graft is not sutured too far coronally or too far apically. You want it right in the vicinity of where you planned the surgery. So it takes some time. You gotta find the right purchase points, find the right papilla, make sure you bite enough tissue so that that graft is really fixed down to that bed of attached gingiva so that it takes. Remember, a graft that moves is a graft that's gonna fail. You want it to be stable. You want it to be stable in place. Once I stabilized the coronal part of the graft, I went to stabilizing the side parts. And I looked for where I had enough thickness of tissue to bite my suture in there. it is better to use a 3/0 gut or a gut suture rather than a silk suture. In this case, I did use a silk suture. Notice how my graft is a little too far coronally. So in the subsequent suture, I'm gonna grab it in a way where I position more tension towards the apical part. That way that my graft gets fixated in the area that I planned it to be fixated. So when do you call it a day? I'll tell you what I learned from Dr. Simon. What I learned is that the graft needs to be stable and not move. So in my mind, I want to put enough sutures without overkill to the point to where I feel confident that my graft is not going to move anywhere. And then I use peri-acryl. Yes, surgical super glue. I take the pipette, I squeeze it to create suction. I put the bottle upside down and then I suction out the glue, the super glue. I then proceed to a dry surgical area and I apply the surgical super glue around the edges, being keen to make sure that that super glue does not get in between the graft and the connective tissue bed. After you apply the super glue, spray it with some water and then dab it with some gauze. We double check, we grab the lip, we move it side to side, and we make sure that the graft does not move with the lip. That way, it's stable and it can heal. Here is 10 days post-surgery. That's how the wound looked. That's how the palate looked. You can tell it's starting to granulate back in. And that's how the surgical site looked. And that's a picture that the patient sent me 2 weeks out.
Let me know if the audio is good.
Excellent. Beautiful surgery, Dr. Rashad. Beautiful suturing. And what I really liked about the suturing is that it was not complicated. It was not overly difficult. You use simple interrupted sutures. You sutured the coronal part of the graft, then you sutured the side part, the lateral parts of the graft. You got perfect stability. And just to be safe, you use peri-acryl, which is we call it, the best kept secret in surgery. So very well done, Rashad. And that's really the key for soft tissue graft. Stable, so they won't have the trauma from the mouth and will heal faster and you'll get a better result. So what we're planning to do here in this segment, we have multiple cameras filming what we're doing. Mostly in this segment, we are filming the overhead, or let's call it the occlusal view, right on top of the zpad. And as part of our training in Suture Academy, we have 3 instruments. By the way, we are sending you those instruments as one of the bonuses: a cotton pliers, a castor viejo, and surgical sutures. So you have a surgical suturing kit included in Suture Academy. So we have that. We have a zpad. We call it now the zpad Classic because we have new ones already developed and in development. Different single sutures. So we'll go over the single interrupted, horizontal mattress, so 2 types of horizontal mattresses, 2 X-sutures and 1 Laurel suture. So that's a cool suture. So we'll share this with you. And then the suture material that we're using for training is silk. Well, silk is legit, meaning you can use silk in your surgeries. It's probably not the best material to use. Why? Because number one, it attracts a lot of plaque. It gets frayed and it gets used up in the mouth, especially a week later. So a lot of the plaque is going to attract to it. But it's perfect for the zpad. So you have 2 options. You can use either a 4.0 silk or you can use a 5.0 silk. Now, remember that as best as we try to simulate the consistency, the texture, the flexibility of the tissue to be like gingival, so in some ways it's a little bit too hard. In some ways, actually, if you tighten the suture too much, you're going to get a cutout, a rip or a tear through a flap. So in our vision, actually trains you to be very, very careful. So what we figured out after several years using the zpad as a teaching tool, we figured out that the caution that you need to use in suturing in one of those in one of our suturing pads, you will need to you will be even more careful when it comes to the mouth. By the way, you see that we're wearing all those booties. This is a white studio, so we don't want to get we don't want to get any dirt on the floor. Thank you, guys. Okay, so zpad, a suturing kit. We're going to be using gloves at home when you use your zpad and you're part of. You don't have to use all the shots and have nice contrast with the zpad and with the suture material. And besides, color is a beautiful thing, so we're adding that into the mix here. And suture material. And I recommend you always use loops. I'm using the Designs for Vision. It's ×3 magnification, which works really well for me. Although I'm already old, but a little bit. My eyes are not the same as they used to be 5-10 years ago, so magnification is the key. Now, when you use magnification, whether you use surgical loops or you use a microscope, you're going to see better. Your entry points are going to be better. The exit points are going to be more accurate. The approximation is going to go. So always use magnification. I cannot work with it without it anymore. I used to be able to no more because eyes are not the same, but even if you're young and vibrant, you still need those loops. You'll have just better performance. So what I'm going to be doing, I'm going to be demonstrating a couple of sutures, and I'm going to be we're going to be filming Rashad, repeat the same thing, and then we're going to do the interaction live. That's going to be part of Suture Academy.
So what we're going to do is we're going to start, we have a list of all these sutures, and then they're going to clap it, and then we're going to do it, and then in between we can interact.
The first 5?
Yeah.
Okay, excellent.
All right, so the first suture we want to do, guys, is the, let me see here.
And I'm going to give also a little introduction on how to hold the needle holder, how to attach the needle.
Yeah.
That's
foundation first. We'll call it the foundation and talk about tools. Do you want to talk about tools first?
Yeah.
Let's do tools.
Yeah, excellent. Okay, good. I get the regular needle holder. There should be one there. The one, not a caster. If you see it.
Find the touches, and
Yeah.
some audio, and we're good to go.
So if you guys are watching this right now, this is behind the scenes. If someone is joining, if they're asking what's happening, you're seeing behind the scenes footage of the live filming of a course, Suture Academy. And we're in a studio right now, and you have behind the scenes access to what's happening. So if we mess up, that's normal. This is part of the filming. It's all going to be edited out later. If you have any questions, put them in the chat inside of YouTube, and we will try to get to them. Stay tuned.
Excellent. That's important.
Guys, let us know when all cameras are rolling and when audio is proper. So see, there's a lot of confusion, like what's, you use silk, you use guts, you use PTFE, all types of fancy names. How to simplify that, and how many sutures do you really need?
Excellent. That's one of the main confusions is what type of suture do I need? Which one is the best? Well, it depends what you're trying, what you want the suture to do for you. If you want the suture to stay in there for a very long time, and you're expecting a lot of swelling because of inflammation, use a material that can stay there for a long time. And that's one of those Vortex or EPTFE sutures that can withstand the pressures from the flap, that can stay there for a long time and has also very nice tissue response. If you or an extraction, and you want the sutures to disappear within a couple of days or a week maximum, use gut sutures. So I'm picking my suture material not because somebody told me, in dental school or in a lecture, use this material. I'm picking my suture material based on what I want it to do. So if I want to suture small tissues, delicate tissue, friable tissue, a small little graft from the palate, I'm not going to use a 2-0 silk suture. I'm going to be using a 6-0 or a 5-0 or sometimes even a 7-0. And that's why you need your magnification, because you won't see it without it. Same thing happens when it comes to, which one is the best needle holder? Should you use the conventional needle holder or a Castro? I mean, the Castro is probably, 5 times more expensive than this one. So why wouldn't I buy 5? Why is that? Well, you can use a conventional needle holder, that's fine. But what happens, you're losing your finesse. You have your fingers locked inside. In order to unlock, you have to do a little bit of muscle movement and instability. The tips of those needle holders are usually pretty crude, although there are smaller ones as well. And for me, it never worked out because we're not suturing a hip or the abdomen. We are suturing tissues that you can't even see. So for that, I recommend you use a Castro Viejo. This is a design that is more rounded, so I can, instead of using wrist movement and using my biceps, I'm just going to use finger movement. Okay, it's like doing this type of movement versus doing this type of movement. So we're not suturing big structures. We're not opening somebody's brain and skull. Suturing tiny little sutures. So finger movement is very important. Now, why do we need to use a cotton pliers? What's the point? Well, God gave us 2 hands, and a lot of dentists, if they don't hold something in their, let's say, non-dominant hand, they start to use their fingers as a tool. So in your right hand, because I'm right-handed, your needle holder, in your left hand, your cotton pliers, and they assist you in very, very gently grabbing the tissue without squeezing, without squishing those cells, and working against the Castro, number one. When it comes to tying a knot, well, then the comes the time to drop. You're going to see now and also super up close in Suture Academy, and tie the knot. And in the end, scissors, there are different types of scissors. You can spend, you know, close to $200 scissors. It's probably not worth it, but make sure that the tips are sharp. You can have them sharpened again to a certain limitation. You can only do it so many times. And we would love to have scissors that have a slight curvature, because slight curvature allows us to go around teeth, allows us to go in the corridors of the mouth. And if the scissors are too perfectly straight, that may be an issue. Okay, so 3 tools. I'm not going to be using the regular. I don't like the fact that my fingers, and I have little used to and enjoy using a Castro, where I use it in a simple pen grasp. The pen grasp is the most natural hold for a dentist, because we hold it like a pen, like a handpiece. That's what we learned in dental school first year. So the Castro is held in a pen grasp, and when we engage the tissue, you want to follow the curvature of the needle. So if you're using a needle with a radius that is, let's say, half or even 3/8, you can see the curvature. So my fingers are going to move along this curvature. I'm not going to do these types of movements. These are stabbing movements. We want curved movements, because if you stab the tissue, you're going to create a big puncture hole, a big perforation. Using the different tools.
I mean, that's, so you're saying just you have finesse with it, you know, the roll it so and enter it at a 90 degree to the tissue. So the idea is when you're suturing, don't do unnecessary trauma to the tissue.
Yes, and for that, you don't need to know all the suture anatomy, but if you look at the cross-section of a needle, you'll notice that it's not a round structure. Round structure doesn't matter which end you go in. Doesn't matter, because a round structure is a round structure. The cross-section of those needles is cross-cutting, because they cut more efficiently. And as they go through the tissue, if you start moving inside the tissue, or you don't go along the curvature of the needle, what's going to happen? You'll have a bigger hole, more trauma, less success, less blood supply, and the whole surgery can be messed up. Hold the needle with in a perpendicular way, perpendicular to the holding instrument, and that's extremely critical. Last thing, Rashad, that I wanted to teach you, we're going to get another Castro.
Yeah.
Let me take a look.
It's
okay.
It's not biting the.
So don't press too hard.
Don't press too hard.
Press lightly.
Okay.
You see, it's actually working. And don't press closer to the holding part. Press exactly above the
serrated area. Okay.
Just light.
Okay.
Okay. Okay. Lastly, when you start suturing, especially when you just use a brand new suture from the package, what's happening? You have all the suture material. Okay. What happens to you when you have a lot of suture material? It gets around teeth, it gets stuck other places. So for that, we are teaching something called the pinky hold. It's a very simple thing. All you need to do is grab the suture underneath your pinky, and it removes it from the surgical site. Okay, so again, you're watching this at home now. In Suture Academy, you'll see in very high magnification the pinky hold. And then I can still use my micro movement of the Castro Viejo. The last thing that I wanted to share with you is what to do when you tie a knot and you have a lot of suture material. A lot of people, and I'm just going to give an example, Rashad.
Yeah.
Take a look at the section number 1 on the zpad. Let's say you go in and you just do a simple interrupted suture. Okay? And you want to tie knots. And you have a lot of to have, you know, too much suture waste and the suture for maybe the whole quadrant. If you have too much suture material and you start with your twist, it's going to get entangled. And that's the obvious, it gets entangled. So a lot of dentists, they just put the needle aside, grab the suture material closer to the future knot, and do it this way. The problem is, you just violated one of the laws of suturing. One of the laws of suturing says, control your suture, control your needle. You always need to know where the needle is. You can't just let it be on the patient's chest or the mouth, because it'll end up in the eye or being swallowed. Okay? So for that, we are teaching something very simple in Suture Academy. And what is that thing? You take your needle, you hold it in the swaged part. Swaged part is the part that connects. Okay, suturing is like playing the piano. Each finger has a number. Thumb, the pointing finger, is 1 and 2. And what we'll do now is something called the wraparound. So instead of losing a needle, losing the control, you hold the needle on the swage part, the pointy part is away from you, and then around the remaining 3 fingers, you'll do something called the wraparound. So you wrap towards you, 1, depending on the length of the suture, 2, and then lock between 1 and 2. Make sure that the wraparound has some tension. If you have no tension, it will entangle. So let's do it again. You hold the swage part between fingers 1 and 2. Wrap around 1, 2, and
Wrap around 3 fingers or 4?
I do 3 because fingers 1 and 2 are okay, do it again here.
And then you can still manipulate the other.
Yeah, and then basically,
can I have a glove?
so there you go. So there you go, Richard. Take a look at this. 1, 2. Now I have a much shorter suture material, and now I can suture. Take a look. Okay, so I basically ignore the wraparound, and I can tie the knot.
Got it.
Okay. Last tip. When you get to suturing, a lot of dentists are using these types of motions. One hand is stable, the other hand, and I'm exaggerating, it's doing something like that. Like playing a music box. The right motion and the more efficient motion is something called a bicycle. It goes like that. So basically both hands are okay? Not one hand is stable and the other hand is moving that, the other way around. Both hands are moving at the same time. So I'll demonstrate that. And the movements are not very exaggerated, they're ever so slight. So I want you to just do this, let's call it yoga, suturing aerobics. And just hold the needle after you did the wraparound. You do this part. Away from you and towards you. Away from you and towards you. If you do it 10 times, what happens? You get a muscle memory. Okay, muscle memory happens, and the more you practice, the better you get. Or the more you practice, the more permanent it gets. So we want you to be practicing the right things. Okay, so this is the bicycle movement.
Okay, I think Rashad, we're ready to
roll.
Yeah.
Let's slate it. Are we good with audio?
Yeah, this what exercise we're doing? This is
We're gonna start with exercise.
Simple interrupt.
Simple interrupt.
Okay. No, don't take it. Sorry, I meant like.
Sorry, buddy.
It's okay.
Okay.
Here.
We like to have fun while we teach. It's the joy is part of it.
Put this in your pocket.
So having a setup like this, giving you doctors quality in education and clarity. Our mission as surgical master is we really want you to understand clearly the details of everything.
Okay, so I think we're ready to go for a take.
Yes. Okay.
Can keep on. Catherine, do you mind doing the slate for us so I can roll cameras? Can you do the slate?
Okay. Is this one? We should have 60 on this?
Yeah. Okay. Do you want to roll this down, please? Why?
So Ziv will make the intro. We'll intro, and this is what, like 90% of your sutures are with this.
Okay, simple interrupted, take one.
Yeah. 1, 2.
Hey everybody, welcome to this video. In this video, we're going to be practicing and demonstrating the simple interrupted suture. Simple interrupted is more or less 9% of all of your sutures inside the
Sorry,
surgery.
I have an issue with just cut. Let's just start this one.
Should we cut or should we just...
Let's cut, let's cut.
Bro, yeah.
We can, yeah.
Here we go. Okay. So we can roll. Okay, good. Rolling? Yeah. Okay, simple interrupted take 2.
Hey everybody, welcome to this video. And in this one,
We just double check audio, make sure audio levels are good.
Test.
test, 1, 2, 3, check.
Test 1, 2, 3.
Rashad, how's the audio on Doctor's son? Just double check.
You got good audio there?
Yes.
Can you hear? 1, 1, check. 1, 2, 3. Check. 1, 2, 3, check.
Yeah. Are you recording? Good. Okay, and action.
Welcome everybody to this video. And in this one, we're going to be teaching and demonstrating the simple interrupted suture. Simple interrupted. The sutures that you'll be performing in periodontal surgery, implant surgery, graft surgery. Yes, simple, interrupted, and it is simple. What we need to do is focus on a couple of elements when it comes to suturing or executing a simple interrupted. What do we need to do? We need to have the right approximation of the two tissues. We need to have stability, and we need to have a knot that is not going to open up. So the simple interrupted will give us all the important elements for success, and you'll be using the same elements in the other sutures as well.
And the simple interrupted, you said it's 90% of all suturing. You can really go your entire career with a simple interrupted if you're just doing extractions, implant and covering, and be okay. The idea is you'll get that base, but then you'll get more so then you can develop your skill set.
Excellent. So that's 100% right. The simple interrupted suture is simple. Suture strategy. Where do you put your first simple interrupted? Where do you put your last one?
There was a sound. There's somebody walking over.
Okay.
You know what? Let's cut because we're going to move the masks. Yeah. Is that okay? So let's cut cameras. That was a good test. Audio sounds great. Let's cut.
If you feel better with the mask on, it will be okay. That's better.
Yeah.
Yeah. If he's okay with the mask.
How's my audio with the mask?
Aesthetically, how's the audio?
It's here. Can you speak one more time?
1, 2, testing. 1, 2, 3, test. 1, 2, 1, 2, test.
Yeah, it's
1,
fine.
2, 3. As long as the audio is good.
Yeah, if it's fine, it looks fine. You just
Okay.
Did we cut underneath one? Yeah.
From the beginning, or just from? Okay.
Let's take it from the top.
So I'm gonna after the intro, I'm just gonna repeat how we hold the suture 90 degree. I'm going to point to which section we're going to be working on and why we're starting there. Okay, number 3. Then I'm going to talk about, again, the wrist movement, how we go in, how we go out, how we predict that. I'm going to give some precautions, not too close to the edge, not too far from the edge. Then I'm going to repeat the wrap around again. And then I'm going to talk about twists, twisting one way, the other way. Something called back and forth.
So the exercise is the dance.
This is the dance, or just all around simple interrupted. Then we'll apply the same principles with the other ones.
Simple interrupted. Take 3.
Hey everybody, welcome to this video. Sorry.
Okay, and action.
Hey everybody, welcome to this video. And in this one, we're going to be teaching and demonstrating the simple interrupted suture. Yes, simple. It is simple, it is interrupted, and it's 90% of all the sutures or the types of suturing techniques that you'll be using in the mouth. So if you can master the simple interrupted, and there's a lot to master here, and we're gonna, even in this short video, you're going to learn so much, so many principles that you'll be applying to all the other techniques. So if you can just master this, Rashad, you can now perform probably 90% of all surgeries coming your way in your practice.
90%.
90. Okay? So pay attention to the different elements. I'm going to be repeating certain concepts that I reviewed with you before as well, in regards to how I hold my instrument, how I grasp my needle, about the entry and exit points, how do I navigate going in and out of tissue, and what everybody wants to know, how do I stabilize a knot that doesn't open? Is it possible? Yes, it is possible, and it doesn't mean that your knots will never ever open. These things happen. There are different factors that we'll review later in Suture Academy, but I'm going to show you the best practices to stabilize a knot. What is a knot? A knot is a controlled entanglement of a thread. Okay, we have threads that can entangle when you don't control it, and that's a problem. But if you control when the knot is going to lock, and that's close to the tissue, you can master suturing. Okay? Any questions before we start?
No, I'm excited.
I'm excited as well. Okay.
You're telling me 90% of your suturing can be done just by perfecting.
If you perfect your simple interrupted and you apply all the principle taught in this video, that's going to carry on to all the other suturing techniques.
It's the basic layer of knowledge.
That's it. It's the foundation, the lower layer of all the bricks, the foundation in the ground. Okay, nice. Excellent. So let's taking out your suture material from the package. As you can tell, with your silk 5/0 or 4/0, the threads are pretty long, So the first thing that I want to do is not poke myself. We're not treating a patient. This is a zpad. It's pretty clean. There's no contamination. But let's practice safety. So always grab the needle, ideally in the swage part. The swage part is the part that connects the thread material to the needle. Mm-hmm. Excellent. And then when you use your castro to grab the needle, you will grab it in 90 degrees. Okay. Now, in the later videos in Suture Academy, I'm going to show you why sometimes we need to grab the needle in 45-degree angle. You want to go around the corner, certain areas that are hard to access, suturing the palate. But for the purpose of this exercise, grab the needle perpendicular to the castro, 90 degrees, okay? And then take your castro and practice a couple of moves. The first thing I want you to do is first practice a crude movement. A crude movement is a movement where you can actually see the hand moving, or you can see what we call a wrist twist. And I'm exaggerating this on purpose, and this is what I don't want you to do. I don't want your hand to be almost visible when you move your needle. So I want this to be like a rolling motion in between the fingers. You are microsurgeons. You are suturing structures that are very small and fragile. We're not operating or with gingival, suturing grafts, suturing papilla. Practice the twisting of the fingers first. Next exercise, which is basically like suture aerobics, you have a lot of suture material. I want you to now implement your pinky hold. So you use your little pinky here, and you grab the suture material. Why do we do that? Because we want to keep the suture material away from the mouth, away from the suture site. So by
I think it's okay because that camera's on.
Yeah, it's on you, and you're looking, so it's fine. You know, on him is good. It's just this one.
Just died.
Oh, battery died. Okay, go ahead, change it.
Yeah.
Sorry.
Okay, no problem. So that's good. So for you guys watching this now at home, watching the recording, so cameras can run out. What happens? We got like suitcases full of batteries in cars here that we can change all the time. So we're going to take some breaks and make some corrections. Continue. So where I was. Pinky hold. Oh, okay. Pinky hold. So the pinky is the smallest finger. Okay. And I know it feels awkward initially. Okay. We have maybe some arthritis. Who knows? But it's actually not that bad. Grab the suture material with your pinky, and then practice your rolling motion. Okay, pinky. Now the pinky hold has to hold the thread with a little bit of tension, tiny bit of tension. It can't be loose. If it's loose, you're defeating the purpose. You need to have a little bit of tension. This is by the pinky holding it. And if you're more comfortable using the next finger, finger number 4, that's okay too. But the pinky is quite well. Works quite well. Okay. The zpad was designed in a way where you have different regions, and each region has a number. We have 5 regions, 1, 2, 3, 4, 5. You see this in Roman letters. We're going to be working on region number 3. Region number 3 is basically a straight incision line And when you see those tiny little dots, that's basically a way to cheat. It gives you about 3 millimeters from the edge of the flap. So this is more for a beginner, and I'd like you to start there even if you're advanced. And then later on, you'll practice on section number 4, where you don't have those cheat sheets, or you don't have this cheater system where you need to know where to enter the tissue. The other thing that we designed inside the zpad to help you, actually help us teach you, we designed the zpad compass. So you see the compass between sections 3 and 4 that says buccal, lingual, mesial, and different layers of the zpad, different spots. I'm going to talk about mesial and distal, and now you can actually watch the video. You're seeing it right now in front of you. You can pause it, and you can basically repeat what I'm sharing with you. So 5-0 or 4-0 silk, you are in a pinky hold holding your castor viejo. You're very comfortable with your rolling motion, with your microsurgery motions. Now identify section number 3, and let's start with the 4th hole from the left. So let's count 4, Rashad. 1, 2, 3, 4. And let's engage from buccal to lingual. So even if you have to move your hand a little bit this way, your finger rolling is just the same. So I'm going to go in hole number 4 from the buccal. Line. As it passes to the lingual, you will start doing the motion, and you want to see the tip coming through the lingual hole. Again, hole number 4. As 2-3 millimeters are showing, you can now take your castro, grab it, and I see a lot of dentists rushing. The suturing has to be done very slowly. Put your cotton pliers to the side. Grab the needle in the swage part with your left hand, with your non-dominant hand, and keep pulling until the short end is about more or less 10 millimeters, 8 to 10 millimeters. Now you have a lot of suture material out there. So if you start suturing now, everything will get entangled and you won't get a good result. This is where you need to start implementing the wraparound. What is the wraparound? The swage part is held between fingers 1 and 2. In this case, twice. Grab it between 1 and 2. And now I have a much shorter suture material, and I have my short end, and now it's the time to tie knot. Okay, so far so good? Perfect, excellent. Now, this is where, if you did everything perfect, you can still mess it up. Because now we want to have a perfect knot. How do we create a perfect knot? We create twists in different directions. So the first direction, it doesn't really matter. I usually do it away from me, and I don't use one hand and the other hand is stable. I use both hands in a bicycle motion. And I'm going to do 2 twists away from me. So here's 2, 1 and 2. And just to practice, go back again. Release it. Just practice the twist. 1 and 2. Now we're going to go for our first twist, first stabilization of the knot, which is the most critical. If you mess up the first stabilization, there's a very good chance your knot is not going to be stable. So let's try that. 1, 2. Grab the short end with your castor viejo, not too close to the end. Make sure it's there. Very carefully pass the 2 twists away. And now we want to stabilize our knot. So what are we going to do? We're going to pull, flap with the tissue, and do a motion called back and forth. Back and forth. What does it do? It stabilizes the first twist. 1 and 2. Do it very slowly. And one way to know if it's stable enough is release the short end and see if there's any movement. Very little movement. So I'm going to do a little bit more back and forth. You can always go back to the wraparound. And lastly, now we're going to go one counterclockwise and one clockwise, or away from you. So what did I do here? I did 2 away from me, 1 towards me, and 1 away from me. And what it does, we did a total of 4 twists. That will give us a stable suture. Because I left it short and pretty short, all I need to do is cut the long suture. And that's a simple interrupted.
Easy.
It's very easy.
Yeah.
All you need to do. Okay? Let's do one thing without stopping. And let's capture all the hand movements, the wraparound, the pinky toe. So the suture came out of its packaging. I hold it very carefully, not to poke myself. I grab it in 90 degrees. I use my pinky hole. Left hand is holding cotton pliers. And I'm going to go to hole number 6. And this time I'm going to go from lingual to buccal. Go through the lingual. In section number 3. Exit the buccal. Grab the edge out. Now there's no more need for the cotton pliers. Grab the needle in my switch part. And I start my wraparound already. I'm going to do 2 wraparounds, maybe 3. Stabilize it. And now I'm going to go for my tying of the first. Grab the end. The back and forth is the one that stabilizes. So I do it typically 2 to 3 times. Then I check. I let go of the short end, let go of the long end. If the knot is pretty stable, I can go for the next twist. If it's not stable enough, I'll do a couple more back and forth. That's the key. A lot of dentists don't do back and forth. Now, away from me. And after the third one, the knot is going to be already stable. Simple interrupted. This time around, you're going to cut the suture, and you got yourself a perfect knot. High chance it's not going to open up.
Beautiful.
That's all. That's 90% of suturing. Let's go home.
Awesome.
Review those principles and practice this on your zpad.
So great. I think when you do and you show it, you guys have the camera on me. So here's a great specialist showing, and a general dentist showing that hey, it can be done. And then Ziv at the end. I'll let them know now it's your turn, and then you say, let them know that it's your turn, and then let's end the video with to your surgical success tagline that you're famous for.
Okay.
We have a formula.
Okay, so you want to repeat that?
No, just the ending part. So and then just you can ask how am I doing, and I did it over here after seeing you. And then you can say, there you go, that's a simple interrupted 90%, and then to your surgical success.
Perfect. So how did it go?
It went well. It went well. I did one, and then I'm starting another one.
Excellent. So you try this now on your own zpad to your surgical success. We'll see you in the next video.
Okay, let's cut. Cool. Let's do about 17 minutes. So what I was thinking, I'm going to switch the mic. This mic is some of shots that make sense for people want to hear.
Discuss a little more on each suture, what it's used for. So this, let's just go over what procedures each one is for, so it's solution based.
Okay. Do we go back to the simple interrupter?
I wouldn't go into detail on all the different dances of it, but simple interrupted, and let's discuss where it can be used, and then then we'll
take that from the wire. Just want to double check.
What's that? So without going to the horizontal.
none. And then I will just go just each one, and what are the indications for? So horizontal, when would you use a horizontal?
For large flaps when you are expecting a lot of swelling.
Excellent. So that's the kind of dynamic.
Yeah.
Because it's organic.
The two types of horizontal application.
Excellent. Thanks.
Next one, right? Give us a second. Are you recording the footage from the microscope?
Yeah.
So next is
I just want to do the ending for that first one more time, so we get into the groove, and then we'll go to the next one. Is that cool?
Yep. Sound you only just
That sound, yeah. Let's cut it. Can you just hand me the little device?
do you have to cut this all the time? This audio? And that's storing onto.
Okay, just put it back in. Okay.
So let's do a pickup.
Just try to tuck in the wires as much as possible. So where do we continue?
Just so let's say this simple interrupted 90%, just like a recap of the simple interrupted, and now this doctors, they saw it. Now it's their turn to execute it. They'll be able to replay the video in slow motion and follow the steps, and then do surgical.
Okay, I want to roll camera. Camera's rolling. Camera's rolling. You get the wire rolling.
Can we test the sound real quick?
Test. 1, 2, 3.
Test.
Perfect. Okay. Yeah, rolling. Okay. Okay, simple interrupted pickup, take 4. 1 second. Okay, and action.
So the simple interrupted is the most common suture in your surgeries, 90%. What you need to focus on is the proper head movement, proper stabilization, doing your twists, keeping the suture ends close to the tissue, and constantly looking at your knot as it's being formed. If you see some looseness at the beginning, don't continue to the next twist because your first twist was already loose, and it's not going to get tighter, with the exception of other suture materials. So make sure to repeat this suture now. Time you have two structures that need to be approximated, like a flap, like a papilla, like around implants. That's when you will be using your simple interrupted suture.
So extractions, implant and covering, stage 1, stage 2, if you're placing all simple interrupted, which is big majority of what us general dentists use in our practice. Ziv, I'm having issues with the gastro slipping. The thread is slipping through. And I'm trying to do, does it maybe have to do with this gastro that I have?
Why do you think the thread, why is the gastro touching the thread? You mean in the time of the knot?
Yeah, the time.
Okay, so the different types of gastro, if you compare yours and mine is a little bit smaller and finer. Just because this gastro costs 5 times as much as this one.
Okay.
Okay, so it's a higher level of gastro, more fine. If you're with catching what you need to do, first of all, you can invest in a better gastro, number one. Number two, don't grab it with the tip. Grab it in the middle and keep the short end a little bit longer.
Okay.
So you have more to grab.
Okay. Perfect.
Okay.
Excellent. So I did it. I'm a general dentist. You can fast track your learning of suturing. Follow the steps that Dr. Ziv Simon is teaching. And Dr. Ziv, any last words?
You try to watch this video again, and we'll see you in the next one. Your surgical success.
Okay, let's go. Good.
So, and we'll have that, and then we'll keep running through them. The first one takes longer than the others.
Yeah.
So if you guys are watching us live still on here, this is part of the filming for Suture Academy.
Yeah, I want to switch mics.
And it's called Master Your Suture. Yeah, so if you're asking about close-up shots, this is going to be part of the actual course. As you see here, there's a lot of different cameras, so it's pretty hard to give you the close-ups on everything. The actual course will have not just close-ups, it's going to look humongous. Each suture, everything is going to be really, really clear. And we're shooting it at 60 frames per second. What that means is that whatever Ziv is doing, however he's teaching it, is going to be done in slow motion so that you're able to follow through with that. So thanks for watching on this broadcast. Pick up whatever tips and tricks that Ziv is teaching, but to get the close-up stuff, that's going to be part of Suture Academy, and we are going to be releasing registration for this course probably tomorrow, so stay tuned, and we're going to give you a little, I'll try to see if we can get some samples of what the actual close-ups will look like, so you can see for yourself and see if that's actually going to be able to help you. Ziv has been, how long have you been teaching suturing for, Ziv?
20 years.
20 years. So there's a lot there to learn, like 20 years of experience handed on a silver platter from Ziv.
Served on a
Z-pad. So, yeah.
Excellent. And we will be able to show you some snippets and some reels to see how this looks like. I mean, I was amazed at the shots that these guys were able to get those videos so up close. It almost looked like it's, it was like a little bug, a little ant sitting on the Z-pad.
Yeah.
And it's very effective in terms of training. When I started teaching, I used to teach on pig skin, which is extremely dense, nothing even close to ginger. We used to suture oranges. So we like oranges and bananas, but as fruit, not as suturing aids. The Z-pad is specifically designed to teach a dentist how to suture like a periodontist. We want you to be able to do surgeries like a periodontist, and we want you to be able to suture like a periodontist, because it so happens periodontists have a great reputation when it comes to soft tissue management, and suturing is part of that management.
Awesome. And we'll work on sending you a video of the close-up shots. We'll try to do it, in the next few days, so that you see a sample of what that's going to look like.
Excellent. So we ready for
Thank you, Patty, for monitoring the chat. If there's any questions, just write them down.
Yeah, questions as well. We'll take some questions in between the shots. Yeah, so keep asking questions on the chat. We'll some of them in between the videos we are currently filming.
And Ziv came up with the zpad Survival, which is not just intraoral, it's extraoral. And Ziv, how many of that? We're probably, we haven't released that yet. So we're gonna be doing a raffle to those who ask questions and engage. And we're gonna give away, how many do you wanna give? 1, 2, 3.
Let's do 5.
5. He's a generous guy. So we'll give away 5 zpad Survival. And Patty, can you get us that yellow zpad Survival so we show it to the doctors?
Okay, so what's next on the agenda?
Horizontal mattress. Should we do 2 horizontal side by side? 1.
Okay, so did we already do the implant and covering stage 2? Implant placement?
Yeah.
All that.
So that is fits with the interrupted suture. What you're looking at there is another one to look at.
Okay.
Ziv, you can show them that zpad
Yeah.
Survival.
So yeah, this is a survival. Basically, what it has the different facial structures. So, you know, not to make it too scary, not the whole head, but you have different parts. Okay, so this is the survival one. You have a nose with laceration. We have an ear that is a little bit messed up. You have a forehead, eyelid. And what's very relevant to us as dentists are lip lacerations. We have a couple of chin lacerations right above the lip. Tomorrow, Jason Champagne from Beverly Hills, he's a plastic surgeon that is going to teach us how to suture up these types of injuries. Not that we are in the, how should I put it? We're not supposed to suture up facial lacerations, but listen, if you're the only person around, you want to learn how to suture the lip. So we're excited about that as well.
I think the inside of the lip is important. Sometimes in our careers, sometimes early on, we can damage the lip with the burr.
Patty?
Sam, you got it?
Yeah, so next on the horizontal mattress.
So 5 zpad Survival will be given out in a raffle to those who ask questions over the next couple of days. And Patty will keep track of that.
Awesome.
So the next thing we want to do is the horizontal mattress.
So we should do one video, external and internal.
Yeah.
Because it could side by side.
Yeah. So what is the when they roll? We'll discuss that. So you guys, when you're ready, just let us know and we'll start. Okay. So Ziv, how did you get the idea for the zpad Survival?
zpad Survival. I don't remember. I remember we wanted to come up with a new zpad, and then I thought, you know, we all, somewhere inside us, especially us dentists that like to do surgery, we're like almost like frustrated surgeons, medical surgeons, and I felt like, how much fun would it be to practice the same types of sutures just on something else outside the mouth? And then the idea came to create a zpad Survival. And initially, and you'll see this in some future videos, initially we had the whole head. We actually took an impression of my face, put it on the zpad. It was actually not fun. So what we did, we took the face, cut it up, separated it into the different parts, and injured the lacerations. And then what happened, it made it more fun and less scary. So that's how it came about.
Okay, we're good. Move forward, take the horizontal mattress, take 1.
Yep.
Okay. Right, let's have the audio release.
What I'd like to do is sort of just, if we're rolling, we'll close it with your surgical success, and then we'll just go into the next one.
Patty, do you want to take this laptop and it's on the chair there. There should be a charger.
Rashad, can you smile to the camera?
That's good.
Do you want to check the audio on
I checked.
it's good for levels?
You
Jazz?
check. Yeah. I checked with the
Okay, so I'm gonna roll.
Okay. And roll it.
Okay. Horizontal mattress, take 1.
Okay. 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 So I'm going to highlight them all. Do it in the checkbox. So when between camera takes,
Okay. Alright, camera set. Audio is good. Okay, and action.
Hey everybody, welcome to this video. And in this one, we are going to be teaching and demonstrating the horizontal mattress. Have you heard about the horizontal mattress before?
From you, and you know, in school, but you hear these names, but
What does it mean?
what does it mean?
What does it mean?
When do
Okay.
you use it? I mean, mattress is something you sleep on. You know?
Right. You know, to be honest, the part of the mattress I still did not figure out, but let's talk about the horizontal part.
Okay.
So first of all, a horizontal mattress suture is a type of suture that creates very tight approximation. You're expecting a lot of swelling and inflammation, like with GBR, big bone grafts, blood grafts. The tissues are going to swell. You need this type of horizontal mattress to keep things very tight and close. So just big picture, clinical, this is what you need it for.
So if big flaps where you're going to get swelling, the horizontal mattress is the solution. That's the solution for swelling, big flaps, extensive surgery. That's what you're getting at.
Correct. And one more thing that is just practical. If you have a big flap and you need to close it quick, you put a couple of horizontal mattress, 2, 3, 4, it's closed. You can send the patient home. It's not ideal, you're not done, but let's say there's an earthquake, there is a flood, there's no electricity. A couple of horizontal mattress, the big flap can be closed. You don't have to do it in half an hour, you can do it in 3 minutes.
Interesting. I'm excited to learn it.
Okay, I'm excited to teach it.
Awesome.
Component is. So let's look at section number 3. Section number 3 is our incision line with those little dots. If you want to approximate 2 flaps, if you want to push them together in a very tight and predictable way, the horizontal works the best, and the part that compresses or applies the pressure is parallel to the incision line. That's why they call it horizontal. It's horizontal. We'll talk later on about the vertical. So we have 2 types of horizontal sutures. One is called the horizontal suture visible, meaning you see the horizontal pattern. It'll be very clear once we demonstrate it. And the second one is called the horizontal suture hidden. So the part that pushes those flaps together is hidden, it's not visible. And the second part, the second type, is the one that we use when we do a lot of bone grafting, because this type of deeper, and as those sutures go on top of a membrane, it keeps it nice and tight. So let's see how both of them are working. Okay. So again, take a look at section number 3, incision line. Okay. And the path of the needle, and I'm going to basically use our zpad compass. We're actually going to enter from the mesiobuccal dot to the mesiolingual, then go to the distolingual, and then go to the distobuccal, and then we tie a knot. So at the end of the suture, we want to see two lines of a thread material that are parallel to the incision line. So let's get started. So again, I'll do it very slow. I'm going to start from the mesiobuccal. Okay, don't forget about your finger rolling. And exit through the mesiolingual. No need to do any wraparound because we are continuing our suturing process. Now, we're going to go back through the distolingual. Okay, so just the dot next door. And exit through the distobuccal. Exit through the distobuccal. Just like that. Okay? And sometimes this thread is going to get entangled on the compass. It's not a big deal. Now, what you want to see before you tie the knot, and this is another principle in what we call the laws of suturing. You want to test your suture. You want to see what's going to happen to the flap. So take a look as you simulate the tightening. See what happens to the edge of the flap. They are getting approximated one towards the other. Actually, the tissue is starting to invert, and it's going to be very tight closure. So we know that we're on the right track. And we know that we can now tie the knot. So if you have a lot of thread material, grab the needle at the swage part.
Just hold it there 1 second. Just hold. And then you match it. Can we get a battery? I think these two in the front, then you. These two? Yeah, these two. Yeah.
Do the testing, Rashad. Sorry? Do the testing.
Okay, so let's take it back maybe a couple. Oh, wait, let me see. We'll take it a couple steps back.
You want me to start the suture from the beginning, just when I start the suture part?
Yeah, let's do that.
I'll do a better job.
There's something very relaxing about this.
It's fine.
Okay, will the cameras rolling? Yeah, Roosh. Okay, hands. Roosh. I see you in the shot. Sorry, move the mic. Okay, go for it.
Okay, action. So let's demonstrate. So we're going to take a path from we're going to start, let's say, from this point, from mesiobuccal to mesiolingual to distolingual to distobuccal. Okay, let's see how this works. Okay, so if you have a lot of thread material, use your pinky hold. Enter from mesiobuccal. And come out through the mesiolingual. And then come back from the distolingual and exit through the distobuccal. So before you actually tie don't tie the knot first. Principle of Suture Academy that is called test your suture. Don't tie it first, just pull on the short end and the long end. See what happens to the flap. You see how those two edges of the flap start to invert and get close to one another? That means that we have the right mechanics. That means that I'm ready to tie a knot. If you're doing the testing and it's not doing what you want it to do, then take everything out and start from scratch. Something is wrong in the passage of the needle. So I'm going to now tie the knot. I have still a lot of suture material, so I'll do a wrap around and lock it.
Okay, can we stop there again? So
Yep.
let's start camera. You have to change the memory file.
Patty, that's great. Patty, after this video, surgical success, then pass it on to me, okay? Then we'll answer. And we'll answer them in between the shots, between the takes.
And again, we're going to be giving out 5 zpad survivals. This is Dr. Simon's newest brainchild for the zpad series. It's a zpad that has facial laceration. So if an apocalypse happens, if you're the only doctor around, you'd be ready to help out your tribe, since our world has become quite tribal.
Yeah, quite tribal and quite survivalist.
Survivalists.
Survivalistic. Maybe not.
See, you said something right now. It's horizontal because the suture that pulls is in the
Parallel to
the incision.
That's what's called horizontal.
That's brilliant. I mean, it's a realization on my part.
Yeah. Vertical is different. Perpendicular. Horizontal pulls. That's why it's stronger than the vertical. The vertical, if you take two structures and you have 2 elements, 1, 2, 3, 4, 4 elements, much stronger, as opposed to a vertical mattress that is only two engaging points. Horizontal is a broader area, closes better.
Let's try it again.
Oh, I was going to say. It's because it's over here. It's over here. She's thinking more like it.
Gee, what an interesting year, huh? So the year we did the COVID series, the COVID webinars, that was nice. It was, how many were done?
We did exactly 6 dentist versus corona. Because we started the first week, we closed down. Then we had our daily blog, dentist versus corona, everyday email.
How many emails did you do?
We did what is it, 7 weeks, 7 times 5. What is that?
Wow, that's a book.
No, 7 times. Yeah, we did like 60 emails.
60
every
dentist
day
versus corona.
Yeah.
And what inspired you to write all these?
My practice was closed. I was not going to work. I was just working on equipping my practice. I was working on, encouraging my team. I was working on getting. To be honest, the emails were a relief for me to just express what I feel, what I was going through. And it so happens that it was read by several hundred thousands of dentists.
Wow.
So I was just voicing exactly what a dentist feels when, you have those 2 hands, but you can't do anything. You can't work because you're not allowed to work. So every night I wrote my email, I shared what was new, I shared new protocols, I shared the good, the bad, and the ugly of this whole pandemic. And all good. We're back in business for a long time now.
Okay, let's go through this. Okay, ready? Okay, C. Horizontal mattress.
Wait. This one. Sorry. All right, good.
Horizontal mattress, take 2.
Tie a knot. Before you tie the knot, don't rush. First thing I'd like you to do is test your suture.
Stop.
Use locking.
Okay.
So before you get to tying the knot, don't rush. Rushing is one of the first things, and actually the first law of suturing is suture slowly. That's the key. If you want to work fast, work slowly. It will work much faster. So don't tie the knot without testing the suture. So I'm going to grab the short end and the long end, pull one against the other, and I want to see the mechanics of the two sides, of the two flaps. They're going one towards the other. That means I have the right mechanics. Now I can tie the knot. Now remember that the zpad is still silicone. It still has, quite a bit of memory. It's actually harder than tissue because don't forget that the incision line, they're made inside the mold. So let's see how this works. So I'm going to do my bicycle movement, 1 and 2, away from me, grab the short end, and now make sure that you observe the knot as it starts to tighten, and do something called the back and forth. Showed it to you before, back and forth, and release the short end and see if the knot is stable. If it's not stable, do 2 or 3 more of those back and forth.
What does this back and forth do, Ziv? What's the mechanics?
The mechanics of the back and forth is after you did 2 twists on the suture material, basically what happens, it starts to create the initial stability. If you don't do them, it may not happen for you. Now that I see that my first stabilization, the first twist are already stable, I'm going to go 1 in the other direction. And again, don't apply any pressure on the knot, and do 1 more back and forth. That's it. After the second one, it's already stable. You don't have to worry about it anymore. And lastly comes 1 more twist towards you. Towards you, grab the short end, and then you're ready to cut the suture. I like them to be cut for this type of material about 3-4 millimeters. And you got yourself a horizontal mattress that is visible. Now, when you look at the final outcome, you can see the thread material, the buckle and the lingual, are being parallel to the incision outline. So the incision, that means it's horizontal and it's visible. I'm going to do 1 very quickly. Okay, not going to walk you through every step. I just want you to see how these movements flow. I'm going to do them 1 side by side. I'm going to tie my knot. Before I tie, I do a little test of suture. I got the right suture mechanics. Perfect. I'm going to do 2 twists away from me. 2 twists away from me. 1, 2. And I'll do the back and forth. Make sure it's tight. If it's not, I'll do a couple more back and forth. And do 1 away from me. And 1 in the other direction. And now I can visible parts of the horizontal mattress are parallel to the line. So now, Rashad, let's work on how did it go, by the way?
I struggled a little bit. I think my Castro.
Would you like to try mine?
No, I know, I get it because yours is a finer Castro, so it's important the quality of the Castro.
No doubt about it.
No doubt about that.
Yeah.
And another thing with the Castro is if it's curved, it's easier to work with as well versus if it's flat.
Okay, okay, and you know, you don't have to break the bank to get a good Castro. We're talking about $150, $180
For a good Castro.
for a good Castro. So it's not, you know, it's an investment very well worth it.
Okay.
Okay, so this was the visible horizontal mattress. Now we'll demonstrate the invisible or the hidden horizontal mattress, where these two lines are not going to be visible at all. So let's see how this works. Okay, so we're going to start from, just to give you the outline, the path of the suture. It's going to go from distal buccal to mesial buccal to mesiolingual to distal lingual. And let's see how this works. Let's take this phone away, guys, because I think it's creating some noise. Thank you. Okay, so now I'm going to demonstrate a horizontal mattress that has the hidden component. So I'm starting from distal buccal to mesial buccal. So just one side of the flap. I'm going to go to mesiolingual. And from mesiolingual, I'm going to go to distal lingual. So mechanically, this is the same type of suture as before, but you don't see the horizontal components. That also helps if you're concerned with scars. So I'll put my cotton pliers aside, and first of all, I'll test the suture. Let's see how the suture works. There you go. So you can see that the two flaps get approximate. Part of the original direction. So let's take a look at what's happening here. I'll cut the suture. Long types of incisions and big flaps, we're going to place a couple of horizontal mattress sutures, whether it's visible or visible, and then we're going to overlay them with a continuous interlocking suture. Crossing over to the lingual, I'm going to mesiolingual to distal lingual. If you get lost, look at your zpad contacts. And before I tie the knot, I need to test my suture. I'm going to test. I see the thing. So next, I'm going to be tying a knot. 2 twists away from me, 1 and 2. Grab the short end. Don't forget about the back and forth. Okay, take your time. A lot of that is failed because of rushing. Okay, let's see, let's let go of the short suture. Okay, it's still not tight enough, so we'll do a couple more back and forth. Okay, if you do too much, then it may rip, depending on the material. So you have to be in tune with how the suture feels like. Then counterclockwise. And this is the horizontal mattress that is hidden. Where those two lines that were there before, they're hidden now. So it's technically mechanically the same suture, but here it's
Excellent. So,
comments.
do you have a preference when to do it hidden, when to do it visible? What's the difference here? Or is it just educational nuance?
That's a great comment, because I look at it as an education nuance, because we want to start developing skills of following instructions, but I also want you to see that the mechanics is pretty much the same.
Mm-hmm.
It's actually simple to do the visible one,
Yeah.
because you see exactly how they align. When we do larger augmentations and there's stuff underneath the flap, like membranes, you want to actually grab the flaps a little bit more in an apical direction. And the hidden one does it a little bit better.
Mm.
So that's the nuance, surgical nuance. My recommendation to you is try both. Mm-hmm. So let's say you have a large flap, do 2, 3 visible, invisible, or hidden. Which one works better?
Okay, sounds good. I like this. So this is for the horizontal mattress, is for large flap closures where you're going to get a lot of swelling. And Ziv, do you recommend putting the knots on the buccal or on the lingual? What's your thought process with that when it comes to bacteria, how to think through your knot and all that?
Great question. So when you think about placing the knot, buccal or lingual, mechanically it's the same. Even mechanically it's the same to put it on top of the incision, which is not recommended because it can get infected. We usually like to put your knot in an area that is not so likely to swell. Usually the buccal tissue swell more. As they swell, they start to engulf and compress the knot. Mm-hmm. So put it on the palate. On the flip side, some of your patients, especially if you're treating a small area, will tell you, Doc, I'm playing with my sutures. They're not playing with the sutures. They're playing with the knot. They're putting it on. So again, my advice to you is try this way, try it that way, start to gain awareness where you can actually control where you want your knot to be. It's, it's up to you. You can sometimes even switch it. You place it in one area, you can switch it to the other one. I don't recommend doing it on a regular basis because the knot can tear and create some damage to the tissue. But you have full control. So the horizontal mattress for tight closure, a fast way to suture a large flap in a matter of minutes. And I hope you enjoyed this video. Now you go ahead and practice to your surgical success.
Cut. Did we lose anything here?
Just the camera.
That's okay. Well, let's continue. It was fine. We don't need it. All right, so the next is, guys, so I want to make sure we manage our energy well. Give some feedback, there, because I don't want us to go through the exercises today.
We basically have another X, 2 X's, and a Laurel.
Can I just see the recorder?
Yeah,
Right?
yeah, we have
X-suture.
2 types of X sutures.
for the X, we got external, internal, and horizontal. 3.
Do you want to continue this video?
Yeah.
Yeah.
No, it's kind of a repeat.
A repeat? Okay.
It's like a repeat. Yeah, we should do the X's in one video because it will match this one.
Okay. Let's just let the cameras rest maybe 2-3 minutes and we can go.
Okay. So if you're watching this on the free broadcast, thank you for tuning in. This is the core course, because you're watching the course being made, this is the actual behind the scenes of one of the components of Suture Academy. Suture Academy is a course that Dr. Ziv Simon shares his 20 years plus of experience in surgery and suturing, so that us general dentists have clarity, have confidence, and know what the heck we're doing when it comes time to suture, because bad suturing results in poor healing and problems. So suturing is the secret sauce to surgical success.
In slow motion.
In slow motion.
And super high definition.
Yeah, that's slow motion, super high definition. That's inside of Suture Academy. We are going to be opening up registration for Suture Academy in the coming days. So if that's a part of your armamentarium that you want to strengthen, if you want to learn more, then join us. We're over delivering. So whatever courses we get, whatever courses we put on, those doctors who do the work, study it, come back and tell us, you guys over-delivered. You gave a lot more than what we expected, and that's how we can sleep well at night. I went through a difficulty growing from general dentist to surgical master. In our industry, unfortunately, lots of people hide knowledge, lots of people mislead, there's a lot of dogma, there's a lot of egos out there, and all that does not serve any of us. It does not serve our profession, and it does not serve our communities and patients. And one thing we're grateful for is the quality of doctors that are part of Surgical Mastery. The doctors who are really genuinely caring about improving, and they love dentistry, and they want to learn. And when it comes to us and my complications, all of a sudden, we feel that, wow, a guy like Ziv has complications, then not that it's okay, but it's part of the normal process of growing in surgery and doing surgery. And to have someone who's as anal and as OCD about his work as Ziv, sharing that openly is truly a gift for our profession. So thank you for tuning in. And we are going to be giving 5 zpad survivals. zpad survival is Dr. Ziv Simon's newest brainchild from the zpad series. Ziv, was it inspired by the pandemic in any way, shape, or form?
That's a good question.
Or was it before?
Oh yeah, maybe. No, I think it was around the pandemic, because the pandemic felt like the end of the world.
Yeah.
So maybe you and I spoke about the end of the world, and we got to be, what are we going to do with people that want to be able to suture? And then we wanted to cater also to medical professionals and doing all sorts of works where hospitals are nowhere to be found.
Yeah.
And they're in a high-risk profession, like one of those greatest jobs where you have to cut trees and you can cut yourself. So we thought about how can we simplify this process without teaching on things that are organic, that will decompose, and it's hard to get. You got yourself a very beautifully designed, thanks to Ian Goodwin, our designer, device where you can just methodically go through different exercises that are clinically relevant. The feel and texture of the silicone in this pad is probably one of the best we've seen, and we experimented with a lot of them. It was quite a long R&D process. And it's still not gum tissue, it's still not the real patient, but we wanted to detach for a student from the real world, just to understand the mechanics. Where the sutures go through, what's the entry point, what's the exit point, what's the mechanics, how to do things in a simple way, and that's translated into a zpad.
Awesome. And 5 of you, we're going to pick from all the doctors who ask questions in the next couple of days, where we are offering a behind-the-scenes look at the actual filming of this course. So we're here in Hollywood, California. Hollywood, that's where dreams are made. And we are filming in a professional studio at a very high level. We're not operating at a camcorder level. The reason we are doing that, and we don't really need to, is because we really take pride in what we're going to put out for you. And we want to, it would be an injustice to not offer that level of quality to Ziv's knowledge, because he's offering it for the highest levels, and spread that knowledge. Because when we spread the principles that keep Ziv operating in a city like Beverly Hills, where you've got a lot of dentists in really the same area competing, and to be successful and to have people actually come to him, and a lot of people are on TV, a lot of people are at the Oscars. You know, it's not an easy thing to deal with very picky patients. It really requires you to be doing things by the book, because they have zero tolerance for any type of mishaps. So we take that knowledge that Ziv shares, we take it to wherever we are in the world, whether you're in India, in Lebanon, in Israel, in Dubai, in the United States, in Canada, Australia, South America, and you can do predictable surgery when you follow the systems that Dr. Ziv Simon teaches. And this is not just me, a general dentist, I've internalized all this knowledge, and I'm grateful to be having a lot of impact on my community, on my patients, and to be practicing in Beverly Hills and doing great work as well, where, you know, my patients are happy because thank God I'm able to offer them great results, because thank God I have access to great levels of education. And that's what we are offering for the entire world, the entire community of dentists. We want you, ladies and gentlemen, to have access to knowledge, so that those people who want to hide it from you or not share it, that's to them. We're going to operate on a different level, because there is abundance in this world, and everyone deserves to know the best ways to do things. And that's really our purpose, our mission, our guiding beacon in all of this. Experience. I struggled, I suffered to learn until I met Dr. Ziv Simon. I was like, man, what a profession. I mean, we're supposed to be colleagues, we're supposed to be sharing knowledge. I love my dental school experience. I went to a school at University of the Pacific in San Francisco, and the quality of educators there was mind-blowing. And then you graduate to the real world, and it's HMOs, production, hurry up, do this, does the insurance cover it? Does it not cover? It just becomes a dirty game, I feel. But I regained hope when I noticed that you can do things the proper way with predictability, and do it to patients who are appreciative, are willing to pay for superior levels of quality happily, because they know that dentistry is not a commodity. Dentistry is a service. You know, dentistry is a service. And whatever we're teaching in any of our courses, we're taking the Ritz-Carlton, the way that's done, and we're sharing it with the world. And thank you, Ziv. Thank you for sharing that, because, you know, a lot of doctors are like, why should I share what makes me successful with others? But I personally think that's a poor mindset. And at one point in my life, I had a poor mindset. Okay. So I understand it.
Okay, it's a scarcity mindset. So, you know, knowledge is in abundance. There's no lack of patience. There's no lack of food in the world. There's no lack of money in the world. You know, you have to do the work. You have to be, you know, focused, and you need to know what you want to achieve. But I want to, speaking of achieving, let's achieve some answers here from those questions on the broadcast. So, question from Green Guy. How do you access the zpad? Well, the zpad is given to you when you join Suture Academy. So we are opening registration tomorrow. So when you join Suture Academy, you're getting the zpad. And you're not getting one, you're not getting two, you're getting 3 zpads, including our survival zpad as part of your registration. Another question from was73. Is there any universal suture material for minor surgery? So I think it comes down to, what does it mean, minor surgery? What is minor surgery? Is, you know, what's minor for me may be major for somebody else, and vice versa. we don't really know, but what I think the question refers to is minor surgery, meaning everyday surgery, extractions, periosurgery. So I would say the universal suture that I use is GUT 4.0. GUT 4.0, it's the suture I use the most prevalently. It's the most common one. It's the most convenient one. It dissolves when the time is right. For implants, bone grafts, not so much for soft tissue grafting, but for the minor procedures, the GUT 4.050 is my go-to suture. So I tell you, go with the gut. Reference here to gut sutures. A question from Megan Dudian. What radius needle, how many millimeters can you talk more about suture needle? Yeah, sure. So the first thing that you need to do, and that's also taught inside Suture Academy, you need to understand the packaging, the suture package. You need to be able to read what everything says in there. So there are a couple of parameters that are written down on the package. So what Megan is referring to is not the radius. Radius, oh, I'm sorry, yeah, you're referring to radius. So on the packaging, you'll see the length of the needle and the curvature is a fraction of a circle. So the most common curvature is 3/8. Okay, if the curvature is greater than that, it's going to be very difficult for you to go through underneath contact areas. Then what's not so very well understood is what type of needle, and the needle itself has the radius factored into that. So for example, the 4.0 that we're using in this training is a C6 suture. There's FS2, FS3. This is a code name for the radius of the needle and the shape. So it's like the code. Okay, that's kind of confusing. My recommendation is try different types of sutures. Are we ready to proceed, guys?
Yes. Take a shot.
Good. So we're going to get started again. This video will talk about X-sutures. We're going to do a hidden. We're going to do a visible one, the Laurel suture. This one. And then we'll end the broadcast. And we'll see you guys tomorrow. Tomorrow we have another broadcast. Part of it. Yeah, let me answer a couple more questions. Patty, come here for a second. Just say hello. With us is Patty, my loyal assistant of over 20 years.
20 years.
In Beverly Hills, and nobody like Patty who knows how to assist a surgical specialist. And you can train your own assistants to be helpful, because assistants are supposed to give you a helping hand. They're not, if you have to do all the work, you are supposed to do the surgery, you're supposed to do the treatment. So the assistant's role is to allow you to see, to suction, have a blood-free zone, and help you with the suturing as well. And also when you make mistakes, let you know.
Right.
Thank you. Review later. Okay, so we're ready to start the next video. Okay, you're gonna love this one. This one's gonna be great.
Excited. See, this is the kind.
Yeah. Okay, so we'll continue with our filming of those different videos.
So we're now the
X-suture. We're gonna do two types.
Okay, X-suture, take one.
Yeah. Perfect. That's it, right? Yeah.
Wait. Smile for the camera, Rashad. I'm just focusing. All right.
Ready?
Yeah.
And action. Hey everybody, Ziv Simon here. Welcome to this video. And in this one, we're going to be teaching you and demonstrating the X-suture.
So when do you use the X-suture?
X-suture is for mostly extraction sockets. When you have something in there, especially a collagen plug or a PRF, you put an X-suture on top of it. So not only does it help hold the flaps stable or even the socket stable, but it also creates a sealing so nothing can come out if you do it properly.
So the X-suture versus the horizontal mattress that just approximates things, the X-suture can be used when you have an open socket that has bone graft and membrane on top of it, and you want to put threads that are like a net so things don't go out.
You got it right. So the X-suture has two main roles: to approximate, but also apply some apical pressure. If you think about the mechanics, and we'll demonstrate it in a few minutes, it closes things up, especially the incision line, but also as you tighten it, it applies some occlusal pressure, some pressure in the apical direction, because you want to keep things in there. Okay, and lastly, also from a practical point of view, if you have a long incision line, I know we talked about the horizontal as being the more common one, but you can also put a couple of X's, one next to each other, you have a flap closed up in a matter of minutes.
Okay.
Okay? So again, we're going to be using our zpad, and we're going to look at number 3. I heard the camera.
Yeah, this is the microscope.
Give me 1 second, sorry.
Can you give me the... Sorry. Okay, good. Okay. So we'll be working on the zpad on section number 3, and moving right along, we're progressing in a distal direction. Basically, when you hear the word X, why is it called an X? Because it looks like an X. So here's your proof. When you did it the proper way, you should see an X when we are referring to the X-suture that is visible. I'll show you how to do an X-suture that is hidden, where you don't see the X, but the X is underneath. Again, when you have membranes and stuff underneath to augment the ridge, it's good to hide it. Okay, and also in terms of scar formation. So let's go path of the X-suture. We're going to go from mesiobuccal to mesiolingual, and then go to distobuccal to distolingual. Mesiobuccal, mesiolingual, distobuccal, distolingual. And I'm referring to the zpad compass. Okay, so let's see how this type of suture happens. So I'm going to start from the mesiobuccal.
Outside to inside, yeah.
Outside to inside and come out. Take it out. And then go to distobuccal to distolingual. Okay, distobuccal to distolingual. Okay, you have in section 3, it's pretty easy to see where it's supposed to come out from. So you have the exit and entry points. And before you're not, grab the needle in the swage part, do your wraparound 3 times, and only test your suture. When you test your suture, you should see the flap closing up and an X being formed. That's the testament, that's the proof that you have the right suture mechanics, and now you can tie the knot. So I'm going to be doing the throws or the twists, 2 away from me, and grab. and one in the other direction, and one in the original direction. And we're going to cut our sutures. And on the flap, I'm seeing the X, and I'm seeing the flaps being approximated. It's pretty hard silicone, so you may not see it closed fully, because if you put too much pressure, sometimes those sutures are going to cut through the silicone. Okay, but I'm seeing a stable knot, and I'm seeing the approximation of the flap and some of the occlusal pressure.
I did it.
You did it. I'm proud of you.
Thank you.
Good job.
Now it's your turn.
Now it's your turn. I'm going to show you one more.
Sure.
Before we finish this video, this is what we call a visible X, because you can actually see it. If we want it not to be seen, because we want to suture the deeper layers of those flaps, I'm going to be entering from mesiobuccal. Okay, actually, let's do one just uninterrupted and unexplained, just to see the flow of the X-suture before we move to the hidden one. So I'll do one more without interruption, without much explanation. Going from the mesiobuccal, exit through the mesiolingual, then enter the distal buccal, and exit through the distal lingual. And before I'm going to be tying my knot, I'm going to first visualize that I have an X suture so that it looks like an X. Okay, and it does what it's supposed to do. It approximates the flaps and creates occlusal pressure. 2 twists away from me. Don't forget the back and forth. Okay, for initial stability. Other direction, 1 twist. And then in the original direction, 1 twist. And then we're going to cut those sutures. And you got yourself a visible X suture. Let's do one hidden. Okay, so you have to imagine that the X is always going to be there, but it's not going to be visible. So this time I'm going to be entering mesiobuccal, but exit distal lingual. So I'm going to go diagonally first. Don't go to the same side, go diagonally first. Then enter the mesiolingual and exit through the distal buccal. So let's take a look at it. So I'm going to do this with some explanation. Enter from the mesiobuccal. Enter from the mesiobuccal and exit through the distal lingual. So that's one diagonal pass in an area that is not visible. 1. Leave a short end. Now I'm going to enter the mesiolingual and exit the distal buccal. Okay, here it is. Okay, now let's test the suture again. You can peek through and you can see that the X is already created in the depth of the tissue. Let's see if it approximates, and it does. It does approximate, so I'm ready to tie a knot. 2 twists away from me. Grab the short end. Tighten. Do your back and forth. Now the silicone may rip on you if you put a little bit too much pressure. After all, it's silicone, so it will not give you any warning, but that also teaches you to be careful. 1 twist in the direction, and 1 more twist in the original direction. Now I'm going to cut the knot. What does the suture, Rashad, remind you of, more or less, at least from the visible part? Doesn't it look like horizontal mattress?
Yeah.
A little bit, right?
Yeah.
It does look like it, but underneath it's actually an X.
It's crossed.
It's crossed, as opposed to the horizontal. I'm going to do one more to demonstrate the horizontal, I'm going to do one more to demonstrate the X-suture that is hidden without too much explanation. Okay, enter through the mesiobuccal, exit through the mesiolingual. Wrong. I'm going to do one more X-suture that is hidden. I'm going to enter from the mesiobuccal, exit through the distal lingual. I'm going to enter from the mesiolingual and exit through the distal buccal. And before I tie the knot, I'm going to confirm that I have the proper mechanics and I have an X developing underneath. I can just peek inside and see the crossover, like Rashad said so correctly. The mechanics is there. So now I'm ready to tie the knot. So 2 twists away from me. Okay, don't forget the back and forth to stabilize the first twist. Then one in the opposite direction. And one in the original direction. And that's your X-suture that is hidden. So you have 2 sutures, X-suture visible and X-suture that is hidden underneath the incision line.
Excellent. See, can we do the, let's take this from this line, what do you think, and do the socket closure? Because the socket closure is exactly the X-suture, right?
Absolutely. You can do it horizontal. You can do horizontal as well for sockets, but I prefer to do the X because you want to hold your plugs in place. Do I need to move the zpad at all, or can I just suture this part? Okay, so let's go to section number 2, where you have your fresh extraction socket. Take a look, and let's do a visible X-suture. So I'm going to go in from the mesiobuccal, exit through the mesiopalatal.
So when you have a socket, Ziv, you go usually from the mesiobuccal because you got 4 corners you can address it. You can go from the distal, the mesial, on the buccal, or on the lingual. What's your thought process from the mesiobuccal, not the distal buccal, for example?
Great. So the thought process is start with the end in mind. So the vision for an extraction socket are actually 2 X-sutures, one on top of the other. So I'll start one on the mesiobuccal, and I'll start the second one on the distal buccal. Because extraction sockets don't tend to swell. We're not talking about major augmentations, and it's quite comfortable for the patient to have the knot on the buccal, not on the palatal. So these types of things. So I'm already planning 2 X-sutures, so I know one I'll start on the mesiobuccal, the other one I'll start on the distal buccal.
Okay.
Okay? Excellent. So here's the extraction socket. One entry point was the mesiobuccal, exit through the distal mesiopalatal. And then I'll pull it out and leave a short end, and now enter through the distal buccal and exit through the distal palatal. And as I do that, you should start seeing an X forming. I can test my suture. This is silicone, so the tissue is going to collapse into the extraction socket. Actually, in a clinical scenario, you don't want that.
No.
So don't suture your flaps too tight because you want to keep enough room for attaching keratinized tissue. Okay, so here's my knot tying. 2 twists away from me. Grab the short end.
You always go from outside to the inside?
We'll demonstrate another one.
Okay.
From back and forth, other direction, and the original direction. And that's your X-suture. When it comes to going from inside or outside the tissue from a mechanical point of view, the difference. But I wanted to share some great point Rashad is making here. I'll remove the suture. Okay, and how do we remove it? I'll grab the knot and place my scissors more or less underneath the knot. That's one. And then I'll cut it also close to the tissue, so I only have 2 sutures to remove with minimal passage of an infected suture through the tissue. So from a practical point of view, it's actually easier to engage the socket, the soft tissues of the socket, always from the outside, from the buccal and from the palatal. And how does it work? Let's take a look at that. Okay, so if I wanted to, let's say in a clinical scenario, I'm still going to go for mesiobuccal. Okay, take it out. Easier to engage from the outside, access, and go through the mesiopalatal. Then go from the distal buccal. Take it out, and then enter from the distal palatal. So you see, I did this all from the outside. I'm still getting a really nice X-suture. I'm getting an X-suture, but it's much easier to go from the outside. 2 twists away from me, 1 twist towards me, 1 twist in the original direction. Okay, then you cut the suture. The reason I said other direction and original direction, it doesn't really matter if you do it towards you or away from you, to be honest. It doesn't make any difference mechanically. Okay? Make sense? Very good. So X-suture can be either visible, it can be hidden. The purpose of the suture is to approximate 2 flaps, but also to apply occlusal pressure, because you have stuff underneath. You did a little socket graft, and that's the ideal indication. You can also use the X-suture to close the flap very, very rapidly.
Awesome. I did it. Now it's your turn.
To your surgical success.
Can I cut it?
You have 1 more, Laurel.
Laurel.
That'll be a quick one. We can use it on the bottom. We can actually use this if you want to take a photo and then offer it as a download for the. It's the same pad I use. I don't know if you.
I just photos, yeah.
Okay, good.
We're gonna double check.
We have a quick video, guys.
Just double check the overheads, see what's happening. I think we may have just finished this one. Yeah. I'm going to check.
This camera's a little overheating or something's happening in this one.
You just stopped? You guys just stopped? You guys finished for a second? Yeah.
So let's have a look.
We'll break.
Yeah, can we,
One more short video.
can we take the camera down so I just want to double check?
Yeah.
Well, these one I'm going to turn them off.
Yeah, man.
It's true, huh?
Yeah. Did you update it?
I don't know which one's this one. I think this is. I'm going to check how much we got yet. Just now. Oh, I think we got it. Thank God. Alright, so
Another one that happens with the battery and that.
right on.
Right after the
Alright. So I'm gonna let that take a break for a second.
Is the battery good inside?
See, the only thing about this table, right, is that this. But hey,
What can you do, man?
yeah, that's good.
It's fine.
You have food?
Yeah, I got food.
I'll just let the camera take a little break.
Yeah.
لا مش يعني مش طالع Simple, horizontal, X-suture, however you then we did this one too. Lower side. It's actually no, we still have these. Okay. These are quite short. I think the vertical mattresses. We have the long one. If we did go slightly long. And the full arch. And you want to just focus that I just say we're going to be. Yeah, I'm going to be longer. Because what they said with the initial view was after 1 day, if you go over the time frame from 8 to 4, then they charge you just the normal rate. It's like 125 an hour. Yeah. Something like that, or 100 or something. 150 actually, but the total will take from the last day. Okay, let me see. Let's see if you do that. What's his name? Rita. Rita. His name is Rita? Rita. So we did that. Nice. Hey, how many people are still on the YouTube of the PowerPoints? Usually it happens. This was on Zoom, yeah.
Right now, 67.
Okay, good.
Okay, guys. So we have several more videos. We're just taking a break because our cameras are overheating, and which is not petty. Let me also answer the questions. Would you get me the? And we are filming this. It will go into an editing process, color corrections, narration, and then it will be exported. And you'll see those videos inside the Suture Academy platform, which is the passport protected. If you're already a doctor participating in any of our courses, you know that all our training is inside password protected platforms where you can access the videos, depending on the course, usually for a full year, interact with the community, and then be able to learn and implement those teachings. We are opening up registration to Suture Academy, actually more than Suture Academy. We're going to be opening up registrations to Masters of Soft Tissue and Suture Academy tomorrow. We feel that soft tissue surgery, suturing are inseparable. They are one. One cannot live without the other one, like a yin and a yang. And it's very important for you to master both. Not enough to just master the surgery and to know where to make incisions. You also need to know how to close the door after the surgery, and you need to be able to suture. So we feel that the combination of Masters of Soft Tissue plus Suture Academy is really the ultimate combination for a doctor that wants to start strong in 2021 and make this a great year. Today, we're filming a segment called Master Your Suture inside Suture Academy. So this product is already, has been out there for more or less 2 years. We have a lot of dentists already inside Suture Academy practicing on Z-pads around the world. Patty, would you bring me one of the mini Z-pads? Petita? Mini Z-pad on the table. Baby one. So we have, we developed this course over years. It's been a work in progress. And we're just pushing the envelope again and again. Today is part of this effort. What I felt was needed was the high quality, high resolution, high definition, high frame rate of video, so you can really see what's going on inside the Z-pad and around, and have such a closer look as if you are right here behind me and looking at, actually more than that, looking at the really at the bacterial level. Thank you. Part of the Suture Academy, we're also giving you. See, this is the mama version. This is the baby version. This is actually for your keychain. We duplicated it in mini, and doctors just love it. And I'm not saying you can suture, but actually it's maybe worth trying. Let's see if we can suture on the mini Z-pad. Are we ready to film another course?
Are we ready?
Yeah. Are we ready? Okay, good. Maybe we'll see later.
Okay.
Excellent. Okay, so we'll film. What lessons do we have today?
You got the Laurel.
Laurel suture.
How do you pronounce it?
Laurel.
How do you spell it?
Laurrel.
Laurrel. Laurel.
Laurel.
Is it Dr. Laurel?
I assume, or Mr. Laurel.
Do we have the Simon suture?
No. All the sutures have been invented already.
We have the Z-pad.
We have the Z-pad. No, it contains all of them. This is going to be a short video. How's the? So we're going to raise this up. I'm going to keep it.
Yeah, I'm just going to look at it real quick. Just look at the frame, see what it looks like.
That's alright. I already stopped rolling on the other.
Press the record on the top.
Okay, comes rolling. This one's rolling. Nice rolling.
Okay. This is Laurel. Take one.
Is this in the frame?
Yeah.
No.
Raise it up a little bit. How are you now? You going up? Perfect. That's great.
Good?
Yeah. Shoulder. It's good. Okay.
Oh, and the last thing, just to record.
Rashad, can I just test your audio?
Test, 1, 2, 3.
Keep going.
Test, 1, 2, 3.
Perfect.
Happy 2021.
Can you make sure your mic, make sure the cables are coming out of your pocket, just kind of like the two main cables?
What do you want me?
Let me see.
It's not there?
It's good. It's just
It should be better now. I tightened it. It wasn't tight.
okay. Okay. Good to go?
Test audio or no?
Let me see. Okay, speak.
Test 1, 2, 3, 4.
That's great. Okay. Perfect. Okay. Rouge, good. Okay. Camera sets. Okay. Okay, and action.
Everybody, welcome to this video, and in this one, we're going to talk about the Laurel suture, or the modified Laurel suture.
All right, sorry, go ahead.
Okay. And action.
Hey everybody, welcome to this video, and in this one we are going to talk about the Laurel suture, or we actually call it the modified Laurel suture. It was modified by somebody called Suturing. Maybe it's from Greece, who knows. But basically this is a type of suture that I just feel is cool to know. Maybe not the most useful suture, maybe not the suture I do all the time, but I use it when the flaps are friable, or when I have a cutout or a tear. It's a type of suture that can overcome that. And I feel that the doctors at Suture Academy can benefit from it, and you as well.
Thank you.
So basically, what's the idea behind the Laurel suture? Basically, we're going to engage two sides of the flap, but one side we're going to leave a little loop, pass through it, tie the knot, and you'll see that the closure happens because of this loop trying to approximate. So the forces are, again, closure, like X-suture, but also a little bit more occlusal forces. Okay, so let's take a look at the zpad. I'm going to be in section number 4. So I'm going to start from mesiobuccal to mesiolingual. Then I'm going to go from distolingual to distobuccal. It's very similar to technically the horizontal mattress, but don't do a horizontal mattress, because before you pull all the suture material through, leave a little loop and pass the needle through the loop. And now take a look at your suture. See what happens when you test your suture. You will see that there's a loop that is hovering above the incision line, helping it close without applying direct pressure. So if you have a tear, you can bypass it by creating this suture. So let's tie the knot. 2 twists away from me. Okay, again, don't forget about your back and forth. Opposite direction, 1 twist. Original direction, 1 twist. So it kind of looks, in a very superficial view, looks like an X-suture, and hence the forces are very similar, but actually inside it's not just 2 threads crossing in an X. One is a loop, one goes underneath. So it kind of closes it up very nicely.
Very nice.
That's all.
Can we do it one more time?
Sure. Go ahead.
I'm going to do it with you now.
Okay. So imagine you're a visible horizontal mattress.
Visible horizontal mattress.
Horizontal mattress. It's the same pass of sutures. So I'm going to go from mesiobuccal to mesiolingual, so it's the same side. And if we wanted to do a horizontal mattress, what would we do? We would go distolingual, going to the distobuccal. Okay, but we're not doing a horizontal mattress, we're doing a Laurel. So instead of putting everything through, pass the needle and its thread through the loop. Pass it through. You see it's passing through. Now pull it through.
So you go from the the mesiolingual to the distolingual, and then, right?
Yeah. And then you test the suture.
So you don't take a bite of the mesial buccal?
You do actually. It's like you take a bite. That's very important to understand. You take a bite. Take a look at here. I'm just reversing my suture. Okay, I'm going to open this up a little bit. There's a little loop that gets created in here.
Got it.
I'm going to pass my needle through the loop.
I see.
Pass it through. Then test your suture. So it looks like an X, but it's not really an X. It's actually a little bit tighter than an X. 2 twists clockwise or away from me. Clockwise doesn't mean much when we're talking about the human body. Other direction. And the original direction. And I'm going to cut my sutures. You got yourself a Laurel suture, so you can hang it on your laurels.
Mm-hmm. So it's like a horizontal mattress, but you pass it through the loop.
Exactly. And then it will never look like a horizontal mattress because it will look more like an X.
Now, when you say tear, how does that circumvent a tear?
Okay, so tear. So let's pretend we have a tear. Okay, let's say we have a very friable. I'm going to make some cuts here in the zpad. It's just very, very torn and either damaged or okay, I'm going to repeat what I did here to the left. Okay, so what I did a couple of tears along the flap line here, or incision line. So what I'm going to do, I'm still going to engage mesiobuccal and go through exit through the mesiolingual, but pretty far away. I'm going to bypass those tears. I'm not going to go close to the edge. Pass it through and do the same thing coming back from distolingual to the distobuccal, passing those tears. Okay, and I made it pretty wide. Now, if I pass my needle through this loop, and I start to tighten a little bit. If I test it, even if my flap edges are a little bit torn and damaged, I can actually get still a good suture without getting too close to the edge. So
thanks for repeating.
2 twists. Back and forth. And the original direction. And cut your suture. That's your Laurel suture.
I see.
Okay, and isn't it fun to do this one? It's kind of fun. You feel like a real surgeon when you do the suture.
Because it puts the tension away from where the tears are.
Exactly.
Wow, elegant.
Elegant.
Yeah. Thank you. I did it. Now it's your turn.
To your surgical success with suturing.
Okay, I'll take.
Are we going now through all that? Rashad?
Yeah. Now we start the slings.
Sling in the full arch closer.
Yeah.
And then we'll be basically done.
Yeah.
So what we can do is,
So we can, maybe close the broadcast, say bye to everyone, and we'll see them tomorrow. Yeah?
Guys watching us in our live broadcast, first of all, thank you for your commitment to learning. I know you want to be in there. I know you maybe want to be with us, but that's not possible. We are broadcasting to all around the world. We had some slight technical problems that we overcame. Thank God to technology. We are filming this course live in front of an audience. You're getting the behind-the-scenes view. The zpad and all our motions are captured at least, I'm counting 5 cameras, different angles, different speeds. You'll be able to see that inside Suture Academy. You'll see the exact hand movement. You'll see the exit points, entry points inside the zpad. You'll see the level of the design of the needle. Those cameras are so sensitive and so much in macro that I think it's unprecedented. I've never seen a suture course that is that detailed and that technically daunting.
We want to create a course that you take it and you're good. There's no need to, just clarity to the point, and it's solution based. It's not memorize these names and do that, because frankly, we gotta mix the solution with the technique for us to really retain it.
Exactly. So we hope you enjoyed this broadcast. We're going again live tomorrow. You'll get an email with a link. Get your questions ready, because we are offering 5 zpad survivals, those yellow cute ones. We'll send it to doctors. We'll just make basically a random raffle at the end of this broadcast series. And tomorrow we'll be opening up registration to Suture Academy and Masters of Soft Tissue. So if you have never heard about these courses, or you've heard of one of them, maybe you're even a member, you'll have the opportunity to join both or join one, and there'll be a bunch of bonuses that are so appropriate for the holiday season. We all are in holiday mood and mode, and we're excited to have you.
Thank you, Ziv.
Thank you, Rashad. Thank you to the team, guys. And thank you, Michael, behind the scenes.
Yes, thank you, Michael. And Michael can see